Recording in progress.
Morning, colleagues. Greetings. Can I greet you, Dr. Liru? Good morning.
Good morning, Chair.
Good morning, Dr. Liklape.
Morning, Chair.
Good morning, Chair, and good morning, everyone.
Morning, Chair.
Yes, good
Morning,
morning.
Chair.
Good
Morning,
morning,
Chair.
Honorable Thai Boss.
Thank you.
Morning, Honorable Mtuwase.
Morning, Chair.
Morning, Honorable Chiram Pungase. Good morning, Minister.
Morning, Chairperson.
Morning, Honorable Sharangu.
Morning, Chair and other comrades. Good morning.
Honorable Mjadu, good morning.
Good morning, Honorable Chair. Good morning.
Good morning, Honorable Mklongo. Honorable Kirake, good morning. I'm doing the roll call. Honorable Muhammad, good morning.
Good morning, Chair. I am so pleased to hear your voice. I'm not well, but I'll join you on the meeting.
Okay.
Yeah.
Morning. Whom did I miss? Honorable Verstappen, I've mentioned you. Leroy, I've mentioned you. Liklape, I'm doing the roll call. Honorable Shabangu, I did. Honorable Sene.
Good morning, Honorable Chair, Honorable members, and everyone in the meeting.
I think I've done the
I'm
roll call.
sorry, Chair. Good morning and good morning to all the members. Thank you.
Morning, Chairperson. Morning, members. Minister, good morning.
Okay.
Morning, colleagues.
Yeah.
Good morning, Chairperson. Good morning, Minister.
Good morning, ma'am.
Okay. Then let's get to. Do we have any apologies? I've got an apology of
You
Dr.
left me, Chairperson. Chairperson, you
Sorry.
left me.
Yes, keys. Good morning, Honorable Kumalo.
Good morning, Chairperson. Good morning to all honorable members and the Minister. Thank you.
Okay, so let me. Good morning, Minister formally and the National Department of Health team. I see you've got a lot of colleagues on the platform. Let me take this opportunity and also welcome all other guests that are here. I think as far as we are now 42 in number in the meeting as we speak, 43. Then I want to welcome all of you. You feel welcome. Can I then quickly ask the Secretary to fly the agenda? There we go. It is as follows. And then I was trying to also check with regard the attendance when I was calling members by name. Then we will have the minister presenting, and then we'll discuss. Then from there we can excuse those that need to leave, and then we consider our draft program as proposed. Then we'll close the meeting. Then that's how the agenda is. Can I get a mover and a seconder for the agenda? I'll see hands. Honorable Sene.
Thank you, Chairperson. I would like to move for the adoption of the agenda. Thank you.
And then the seconder, Honorable Mutuvate.
Thanks, Chair. I'd like to second.
Okay, then the agenda it's adopted. Then that brings us to our next agenda item, just to formally record, I've got one apology from Honorable Likape, who's going to leave the meeting immediately after 10. I have other apologies, Secretariat or colleagues.
Good morning, Chair. No, there are no other apologies. Thank you.
Okay. Then, under the circumstances, then we need to proceed with the meeting. Minister, I want to thank you and appreciate you for responding. You will recall this is the matter that we should have attended to while we were on oversight some 3 weeks ago. But due to the hectic program that we have, we couldn't proceed. And then there's a requirement in terms of the programming and the House Chair's requirements that you need to continually apply for the meetings that are outside the program, the adopted program. You need to apply. Colleagues will recall that we have prioritized the bill. So our program, as you'll see later, is mainly focusing on the bills, but that will deal with that item when we come to that. Then due to the pressing need of this matter, we felt we need to slot in this item. And the minister has definitely responded. They were available that week to present. Unfortunately, when we make the applications, you cannot proceed with the meetings until the House Chair approve your other meeting. So it's very important that we learn that if once we approve for a meeting, if we say we need a meeting, colleagues, we need to proceed with that meeting, because if it doesn't proceed, then you have to put another application. Having said that, I had received also the request of Honorable Chirampungo said that the meeting be held physically, but it was going to mean that we have to again reapply, because initially when we applied, we have applied for a virtual meeting. Then this meeting was not going to happen today, and then it means that we'll have to reapply and wait for permission. And at some point, then we were going to delay this matter. Then even its relevance and the present nature of the matter, then it was going to become futile. Having said that, we then deemed fit that the meeting needs to proceed as applied for. That's why we are here today. And we know, Minister, today it's Wednesday, it's Cabinet Day, if I'm not mistaken, but you took time to be here with us so that you can then respond to the issues that members have with regard to this matter. But the issues that then, Minister, we want to get you to talk to us on these matters, because these are matters of mutual interest. And then I'm ready that we've all received the agenda, the presentation on time. Members had an opportunity to go through it. Then it will make life easier for them to also then interact with you on this matter. Having said that, then I would like to welcome you, Minister, and the team, and hand over to you so that you then do a presentation. The colleagues have read the documents, then I'll ask you to highlight the key critical issues that you feel need to be raised with the members. Then I'll afford the members the opportunity to then interact with the presentation. And thanks once more, Minister, for responding to our call for you to come. Over to you, Minister.
Thank you very much, Chairperson and honorable members of the Portfolio Committee and media who have logged in, and members of the public who have logged in out of interest in this matter. Thank you very much for this opportunity. Chairperson, let me start with what you said, taking this opportunity. This matter between yourselves as the committee, this matter of committee meetings between yourself as a committee, of the leader of government business, who is the deputy president of the country, is still causing us trouble, because I know that meetings of the portfolio committee are called on a Wednesday. And as you have already said in your introduction, Wednesdays are cabinet days. We just lucky that today it's cabinet committee days, but Wednesday is a full cabinet next week. Today there's no cabinet, it's just cabinet committees. So I'm just mentioning so that the matter be looked at, because it divides us between yourselves and the president. And as ministers, we want to respect both, because the president made it very clear that no meeting, no minister must apologize on a cabinet day for local meetings unless it's a matter of life and death. You as members of parliament, you also want your own pound of flesh, because you always want us to be there present. So perhaps between yourself and the leader of government business, this matter need to be discussed so that we are not given the difficulty of choosing which one is more important, because we regard those responsibilities of being cabinet and accounting to the portfolio committee, we regard them as equally important. Having said so, thank you, Chairperson. I was not really asking for an answer today. I was just putting it in front of the committee. Chairperson, let me start by introductions of members of the Department of Health who have logged in here. I'm giving them a chance. I see the DG there. Maybe let me start with the DG. He must introduce himself and introduce the others. The DG, Dr. Sandy Butelezi. DG, over to you. Thank you.
Thank you very much, Honorable Minister, Honorable Chair, and Honorable Members. Good morning. I am accompanying the Minister, and I will request to introduce the team. I'll start with Professor Nicholas Crisp, who must show his face. He's a Deputy Director General responsible for the National Health Insurance. Then I'll go to Dr. Figile Ndlovu, who is the Deputy Director General responsible for HIV, TB, STIs, maternal, child, and women's health. Dr. Ndlovu, please show your face. Dr. Figile Ndlovu. Yes, and then I will go to Dr. Pesi Mahlati, who's the Deputy General responsible for hospital services, infrastructure, human resources for health. Mr. Paswa Mamokhale, who's the Chief Finance Officer in the department, CFO. Then Mr. Modupi Maisela Mdluli, who is the Chief of Staff in the Office of the Minister. Mr. Mdluli, please show your face. Then I see Mr. Moremi Nkosi, who's the Chief Director responsible for benefits under the National Health Insurance, Mr. Nkosi. Then we have Ms. Khadija Jamaluddin, who's the Chief Director responsible for health products, procurement, and affordable medicines unit. Then we've got Ms. Jeanette Hunter, who's the Deputy Director General responsible for primary health care. Then we've got Dr. Mkhanyi Sankuna, who's the head of the Office of the DG. Minister, I think I've navigated. Oh, then there's Dr. Tulare, who's a technical specialist. Dr. Aquana Tulare, please show your face, also within the NHI unit. I think I've not missed anyone, Honorable Minister. Ndate Khatla, Johannes Khatla, is our parliamentary liaison officer. Thank you very much, Honorable Minister.
Before that, Minister, there's somebody that is logged in as Farah's iPhone. Can that person properly put his or her names? Farah's iPhone.
I didn't understand that, Chair. There's somebody who logged in as...
who's logged in as Farah's iPhone. Who's Farah's iPhone? Can we get who
Chair.
that person is? Farah's iPhone, Minister?
We don't know, Chair. Usually, when I'm conducting meetings, I don't usually accept looking in like that. I take them out, so I don't know.
If that person cannot identify himself or herself, I'll ask the team to also remove the person because it's silent. Whose file? Can the person identify himself or herself? Mute. Proceed, Minister. The team will deal with that. Sorry.
Okay, thank you very much once more, Chair, and compliments, because I believe this is the first portfolio committee meeting of health for the year, which I welcome very much. Chair, I want to start with a disclaimer, because we are always put in very difficult positions as ministers. You are aware that we are not encouraged, and I'm one of the people who take that very seriously, to ever get involve ourselves in tender issues, in who gets a tender and who doesn't get it. Ever since I was in government many decades ago, that is the practice I've been following. A very arm's length or maybe double arm's length from procurement issues about who must get a tender. But yet at the same time, when something goes wrong or something is not understood, we are the ones who must account. So I am taking account, that process in motion today. I'm coming to account to you, but I want you to know I've never got involved in who gets a tender. And when you start asking questions, if I'm able to answer them, I will. But if not, I will answer to those people who get involved in the tenders. It is the DG here, as you know, is the person who finally signs. It is the CFO who chairs the bid education committee. Here it is Professor Nicholas Crispy, because the people who are doing this, Mr. Jamaluddin, who is responsible for procurement, reports to him. So those are the four people, but any other of the officials here will try to answer our questions. Chair, can I ask that the presentation be projected on the screen? I think it's Mr. Khatla who's doing the projection, the parliamentary officer. Mr. Khatla, can you project, please? Put it on slideshow, please.
Is it showing? Okay.
It's showing, but put it on slideshow.
Okay, there we go. Thank you.
Yes, Chairperson, as you said, this presentation was prepared long ago when you called us for the first time. And since that time, some things might have intervened, but we made it as short as possible. I'm aware that you have received the document, but we made it as short as possible in order to go through each and every paragraph, because our manner of responding to your document was to follow the letter you wrote to us, Chair. You wrote a letter to me, and that's why I'm the one who's accounting. And you ask us to respond to 4 questions. Number 1, can you put it on the screen? Yes. You ask us to provide request a briefing on contingency plans to secure uninterrupted ARV supply. 2, on the number of patients who are affected by, I presume, by what has happened with some 2 companies being put under business rescue. You want to know how many patients it affected. 3, measures to ensure continuity of care and avoid stock outs, which obviously is something that we've been dealing with for a long time. And then evidence of due diligence conducted prior to the tender being awarded. Those are the 4 questions, and we have tried in the presentation, Chair, to put your questions as headings. But it's important, Chair, to give a background, which to me is very important. As you know, before 2010, South Africa was accused of what we call AIDS denialism, where ARVs were, it was not really government policy at that time to give ARVs. They were being given because there was a court case by the Treatment Action Campaign. And the Treatment Action Campaign won the court case that the state must provide ARVs. I came into the department by 2009. By 2010, even despite that court case, only 10% of government facilities were providing ARVs. 10% of all the facilities. By facilities, I mean hospitals and clinics added together. Only 10% of them in the country were providing ARVs. And we realized that this, while it's compliant to the court order, is not going to help the country. So in 2010, we launched the world's biggest HIV counseling, testing, and treatment campaign, which was launched at Natal Spirit Hospital in Ikuruleni, where we called head of state at that time. We called the United Nations AIDS program, UNAIDS. We called the World Health Organizations. We called unions, etc., etc. And we started that project. Now, that project became so big. On bullet point 2, they were saying South Africa became by far the largest consumer of antiretroviral medicines, which it still is today. You are aware we've got close to 6 million people who are on ARVs. Now, at some stage, and I believe, Chair, that still applies, 25% of all the ARVs manufactured anywhere in the world are consumed in South Africa. So because of those reasons, the attention attracted lots of pharmaceutical companies all over the world. There's no company that does not want to do business with South Africa. Now, having such a huge program attracted other demands. And one of the demands was about local manufacturing. The trade union movement at that time, led by COSATU, because many of these federations that exist now did not exist at that time. So COSATU led the delegation together with some local pharmaceutical companies who are manufacturing generics. They led a meeting to the union building at that time where they were going to demand that such a huge antiretroviral program must benefit the country in the form of job creation. And as such, they demanded that we must make a rule that only local companies will supply. In that meeting, they had called the Minister of Trade Industry, and there was no competition yet. It was trade and industry. It was the Honorable Minister Rob Davis at that time. They called him in that meeting to make this demand. And of course, he said the Minister of Health is the one who will answer this question, meaning myself. I was then called to the union building where the meeting was taking place. And they made this demand to me. We accepted the demand, but found that if we accede to that demand and buy locally, because of difference in prices, we're going to need 15 billion rand more than what we had at that time. And remember, it was 2010. 15 billion rand extra to what was available at that time, which obviously was a question I couldn't answer. I then asked that meeting to call the Minister of Finance. The Minister of Finance at that time was the late Honorable Bravin Gordon. He was brought into the meeting and he said he must answer the question whether the country can buy all the ARVs here and will have an extra 15 billion rand to cover them. And he said, no, it's not possible. There's no amount of money like that anywhere within the fiscus. That cannot happen, even though we like it. So unfortunately then, the largest supplier of ARVs was India. Chairperson, maybe one of you will ask why India is able to do that which we can't. Their situation is very different. Firstly, South Africa does not, as you saw on the last bullet point, up to this day, There's no company anywhere within the Republic of South Africa that manufactures APIs or what you call active pharmaceutical ingredients, not only for ARVs, for all the medicines. When a company wants to manufacture medicines here, they've got to get APIs from India. And secondly, their labor laws are not like ours, so they don't pay much for labor costs. And for that reason, their prices are infinitely low. So when late Minister Pravin Gordhan told the meeting that this is impossible, there's no way they'll provide this 15 billion, we have to choose between treating people and manufacturing locally. And there were millions of people at that time who were waiting. I then told COSATU in that meeting that they must make a choice between us buying locally and supplying ARVs to very few people because we don't have 15 billion rand, and their members not getting ARVs. Choose between that and getting jobs. And it was a very difficult choice. And I said, as far as we are concerned in health, we choose life first. People must live before they can perform any job. So we choose life first. For that reason, we will choose to buy outside the country, even though we know it is going to interfere with job creation in the country. And for that reason, many Indian-based companies started gaining. And we said, over the years, we'll build over local companies taking over bit by bit. So I just thought it's important to give that background. Thank you. Now, because, as we said at that time, we'll try our best to make sure that local capacity built up. That's why at this point, the last bullet point there, we're saying now at least 70% of our ARVs are procured locally. That was not the case by 2010. It was the other way around. So we are procuring 70% locally now, which are finished products. Now, the first question you ask us is contingency plans to secure uninterrupted ARV supply. I need to put it up front, Chairperson, that no one is to force us to make sure that there is a secure uninterrupted ARV supply. No one in the country is to force us, because we know it more than anybody else, because we run the system. I am saying so, Chair, because when you conduct the world's biggest HIV counseling, testing, and treatment campaign in the world, everybody is looking at you. But also, if you make a slip and something wrong happens, many people will suffer. Or not only suffering, it may even lead to death of a large number of people. Those who don't die will develop resistance. And if we have to treat them, we'll need even more money, which we don't have, or which we didn't have at that time. So it's in the best interest of the department and of the people of South Africa that supplies do not experience any disruptions. But unfortunately, much as that is our hope, in the real world, all over the world, there are pharmaceutical supplies associated risks that include, as I'm showing there on bullet point number 1, manufacturing disruptions. They can happen in any country, anytime. It can be regulatory hurdles where your regulatory authority either is delaying or unable to regulate that particular drug, which is new. It may be raw material shortages. Countries get their raw materials all over the world. Something may happen in one country or the other. Or it may be logistical constraints. All these things can affect any supplier during the contract time, or it may even be business problems like the ones the two companies which we are going to discuss have experienced. So we have known that for quite a long time, because it happens quite a lot, whereby we run out of medicines, not only ARVs, any type of medicine. And it's not the fault of the countries, because in the country of origin, there are problems like the ones I've mentioned. So we intentionally, Chair, that's the point we are making on bullet point 2. We intentionally awarded to multiple suppliers as a risk mitigation measure. It was not an accident. It's something that the government deliberately went into to make sure that you award to as many companies as possible so that there's no possibility of a shortage. If any company experience operational challenges, then the next company will take over. And when the tenders are awarded, this is what the companies are told. So the third bullet point, we are making a point there that by diversifying these supply sources, the department responds swiftly to supplier-specific challenges. And companies know that, look, we are giving you so many, but if you fail, we're not going to negotiate, we move to the next person because we want to minimize stock outs because they'll be very dangerous for the country as a whole and for individuals who need these drugs. Thank you. Next. Yeah, we are trying to show you there in terms of the contingency plans. We are showing you on the screen how and who the tender was awarded to. And on the left there, they are showing you the companies and the volumes that have been awarded. And on the right, we are doing the same thing, Chairperson. We still continue the table to show you the volumes. Next. Your next question was the number of patients that were affected. The number is 0, Chairperson. Not a single patient in the country was affected by this business rescue of the two companies because, Chair, as we said, this was planned right from the beginning that nobody ought to be affected by whatever risks because it will be very dangerous. So we can confirm to you that nobody was affected because whoever is unable to supply, we just go to the next company. Next, no, Hadla, you moved before. Have I finished the previous slide? Oh gosh. Is it running around? Yes. So all patients continue to receive their ARVs and other medication. There's never been any disruption whatsoever. So that the answer to that question is 0. Next. Yeah, the measures which we have adopted to ensure continuity of care and avoid stock outs. Here, Chair, I presume the committee is not asking us about ARVs only. It's asking us about all pharmaceutical supplies in the country because all of them, we not happy about stock out. You will be aware that some 10 to 15 years ago, the issue of stock out was a problem. There was even an organization called Stock Out, which was established by Section 27. You remember at some stage, an organization called Section 27 was formed by people who were members of TRC, of Treatment Action Campaign. And one of the issues of that unit called Stock Out was to look at all the supplies all around the country and find out where there's a problem. And these problems, whenever it occurred, was splashed all over the media that there's a stock out. So we could not fold our arms. We did something. We worked with Vodacom, and Vodacom helped us to establish an electronic system, accurate stock visibility system called SVS, Stock Visibility System. This stock visibility system is used in our clinics, and it uses a cell phone. That's why it is Vodacom who designed it, whereby every nurse who is in charge of a clinic around the country is given that cell phone so that they monitor stock, not on a weekly or monthly basis, on a daily basis, so that we can pick up what's happening. In our hospital, we use what is called RX solutions. So stock visibility system, or SVS for clinics, RX solutions for hospitals to monitor stock in the public health system. Furthermore, suppliers themselves not the facilities, but the people who supply, who have been given the tender, have to report on a 2-weekly basis on their stock levels so that we can see if danger is coming. So following the confirmation of supply constraints from because of these systems, the department activated contingency measures by engaging other contracted suppliers to increase production so that they must be able to supply the volumes that we need. As I've already said, we immediately triggered companies and say, you are to supply more than the volumes you are given, please start manufacturing because we have picked up a problem somewhere. Now, based on national consumption data and ongoing stock monitoring, provinces currently hold sufficient stocks of the affected ARVs medicine to cover approximately 3 months of expected demand. Chairperson, I need to explain this again. Early in the days, as I've said, we used to have a company which was based in Centurion, which was keeping extra stock. Please remind me, Prof. and Khadija, what was the name? Buffer, yeah. It was called buffer stock. At any material times, when we order ARVs in the country, we look at 1/3 of the ARVs that were ordered, and we order a buffer which is equivalent to that 1/3, which sits at Centurion in that warehouse of that particular company. And every time there is a chance of a stock out somewhere, we release that buffer stock. And obviously, because many months, even years could pass without any stock out, that buffer stock will expire. So any one time when we realize it's about to expire, 3 months before that, we release it. We release it and get new stock and follow the cycle all over again. But later it was realized that that's not a very sophisticated method. It has got its own problems. So that method of buffer stock based in Centurion was abandoned. And the new method was to make sure that each and every province at any one time, they've got 3 months supply. In other words, meaning if they've got a problem of receiving supplies for 3 months, they will still have a 3 months, that 3 months supply to use while the problem is being solved. And that's one of the new system that we are using. At the supplier level, current stock levels include approximately 2 months supply across 4 suppliers, with additional volumes to be increased in line with the department's adaptive supply chain. So we also want the supplying companies to have advanced stock also more than what they are going to provide. Thank you. Next. Now, evidence of due diligence conducted prior to the tender award. Due diligence was assured during the bid evaluation process, I am made to understand, through the assessment of all bidders against the requirement specific in the general conditions of contract and the special requirements and conditions of contract applicable to the tender. There are specific assessment for all bidders in the state, but there are also general conditions of any particular contract. Bidders were evaluated for both administrative compliance and technical compliance, including registration of the product with SABRA in accordance with the laws. Anyway, we can't purchase anything if it's not registered with SABRA. You know by now that that can't be done. Administrative compliance also include registration on government central supply database, tax compliance status with SARS, and registration with CIPC. All those things are the things that are checked before the tender is awarded. The department does not examine balance sheets. I know the biggest question in the minds of members here, which has been all around the media, is why we did not do due diligence to examine the balance sheet of a company to see that they've got enough money. And it is believed that if we did so, we will then have avoided a company that is going under business rescue. Unfortunately, Chairperson, as far as I remember, there is no tender that has been issued at least by the Department of Health, I don't know by other departments, where we examine the balance sheet of a particular company. And there are quite a number of reasons. Firstly, how do we know that this company can supply? The Department of Trade, Industry and Competition, they follow up on these issues nationally and internationally. They follow up companies, they follow import volumes, they follow export volumes, they follow which companies go under, they check which company does not meet regulatory requirements all over the world. They follow in terms of the rules of the World Trade Organization. So we rely on that department. On our side, we cannot examine balance sheets because, Chairperson, for us to do so, I must state it outright, we do not have any skill whatsoever to examine balance sheets of huge companies, which might be very complex and where they might even waylay us. We do not do that. The only way to make sure that when we check balance sheet, we are accurate, it means we have to hire an auditing company. You know, there are auditing companies in the country. I know 4 big ones. It means you must hire one of them or some of them to examine the balance sheet. Chair, we believe that was going to be a very, very serious expense, which we could not afford while we are running the world's biggest ARV counseling and testing and treatment campaign. We just could not afford that. And we calculated as a risk measure how many times have companies gone under because they didn't have a good balance sheet. And up to so far as I'm concerned, is happening for the first time. When you use common sense, this might look very stupid. I've heard some in the media complaining about a similar instance after Parliament burned down, asking whether the insurance is going to pay. And there was a lot of anger when people learned that the state does not, the state does not insure its properties. No cars belonging to the state are not insured, and buildings are not insured. The state pays cash for that because on a balance of probabilities, they will pay billions more for insuring the property than the properties that got damaged. They will pay billions more to pay for the insurance of cars than cars that are written over. And so they found that it's easier to replace it cash than do that. We are sort of following more or less a similar principle. Is not exactly the same, but is similar. That the chance of companies that have been followed by DTIC going under are so slim that it won't be worth it for us to include in our tendering processes the hiring of an auditing company and pay exorbitant sums of money that we could be using for treatment of patients. So we chose not to do that, Chairperson, because we thought the risk was too small for us to spend that amount of money. And also, we are aware that companies always claim confidentiality. It's not easy for anybody, and the matters sometimes even go to court to get balance sheets of companies because they tell you that this is their trade secret, and they will never be able to they will never be willing to give that information. As I've already said, the last bullet point says DTIC has information on which products are being imported and exported, and the ongoing relations with companies, and this shared with the Department of Health. I've already mentioned this, Chairperson. Can we move? Can we move? Yeah, now the after you ask the questions, Chair, there were latest development. A company named Hetero, which was not awarded the tender and had taken us to court, and that court case is still pending. So before the court case, because we're suspecting price collusion,
Order.
Yes. What's the point of order, Honorable Chiron?
The minister is misleading us on the fact that the NTOH has never required proof of financial capacity from the tenders that they've bid. E-tender year appointment of service provider for the provision of recruitment and payroll administration services for the interim traditional health practitioners council of South Africa for a period of 3 years required that people submit their financial capacity and capability. So we must not be
Chair,
misled
I
by the
thought
minister
members
saying
are
that.
going to ask questions.
Minister,
But he must
allow
not lie to us. He must not lie to us and say that they've never done it. They have done it. It's standard practice. PFMA says it must be done. SCM says it must be done. PPFA says it must be done. So the minister must not mislead us and create an impression that requiring proof of financial capacity in the tender bidding process is not a norm. It is actually a norm. Thank you, Slalo.
Yes, I think let's allow the minister to finish up all the other issues that we want to raise as members who will have an opportunity to talk to the issues. Minister, you wanted to say something?
Yeah, no. I was going to say I thought members are going to be given ample opportunity for a debate. This is not a point of order as far as I'm concerned. It's a debate.
But don't lie,
and the
Minister.
honorable
Don't
member will
lie.
be.
I'm saying stop lying. That's all I'm saying. Stop lying.
Honorable Chiro, he's on the last slide. It's almost done. That's the last slide according to the
Chairperson.
I'll give the members an opportunity to interact and then
Chairperson, I am not lying. I've already said right from the beginning, I've already said it, that I don't get involved in tenders. The information I'm giving you is what I was given by officials within the department. So if it is not true, that is the information I was given, because I don't award tenders in the department, Chairperson. That's information as far as I was given by people.
Yes. The information you are given, and that's fair enough. And the people who gave you the information, they are here, they will be able to respond to the issues. I think you've made your point very clear that you are not lying. It's based on what has been reported to you. Can you proceed, Minister?
Yes, Chairperson, that's exactly how I got the information from officials. And from the beginning, I told you I don't award tenders. I don't know the criteria. All I know is that at least 70% of the tenders will be given to local companies if we've agreed and planned long ago. So whatever I'm giving, information I'm giving about tenders is information given to me. It's not information that is primarily known by me from the beginning, because I'm repeating again and again, I don't get involved in that. So we are ensuring uninterrupted access to life-saving HIV treatment.
Tabe, over to you.
So, no, I was just concluding, Chair, but the conclusions I've made, we've already made there, that will ensure uninterrupted supply. The department has implemented comprehensive measures. The actions reflected the department's commitment to maintaining a resilient and reliable public health supply chain. Chairperson, my presentation ends there. Thank you very much.
Thank you, Honorable Minister. And thanks for the presentation. I think now I'm going to note hands for colleagues who want to raise issues with you. I will ask Dr. Lekape to be the first one, as he has requested to be excused. Then it's going to be followed by Honorable Shirwa, Honorable Klake, Honorable Jadu, Honorable Van Staten, Honorable Mutuvatse, Honorable Liru, in that order for now. Dr. Lekape, over to you.
Thank you, Chair. Good morning to everyone. Good morning to the Minister again. And thank you for the presentation.
It's so dark, we can't see you, Dr. Lekape. Just a shade.
I don't know why. Maybe it's a technical issue, Chair, because I put my video on.
Just switch it off for the sake of yeah, finally. Now we can see you. Okay.
So can I switch it off for transmission purposes since there's proof of life now?
Yes.
My question, Minister, is about the prospects for the future. There's been discussions about a state pharmaceutical company. When are we likely to see that come? Because it can give us security of supply across most products. And that's my only question, Chair.
Minister, can you respond to that? Minister?
Sorry, Chair, I was muted. I was not aware that I'm muted. Thank you. Yes, Chair, the issue of a state pharmaceutical company was, the resolution was passed as far back as 2007, that we need a state-owned pharmaceutical company, which the Department of Health must establish. At that time, we already have a BioVac, which is manufacturing childhood vaccines. The Auditor General queried BioVac being owned by the Department of Health, which is also the department that benefits, and said we must take over the ownership of BioVac to the Department of Science and Technology, which was done. So the same was done with the issue of establishing a state pharmaceutical company. It was moved out of the Department of Health to the Department of Science and Technology at that time. Now, the minister, when this thing was discussed, was Honorable Naledi Pandor, who had discussions with me, and we found that if the state establish its own pharmaceutical companies, it needs huge capital, which at that time did not exist, or they will have to produce and sell at a very high price. The minister then wanted me to put it in writing that will be able to buy from that state-owned pharmaceutical company. Our position has always been that this is not a health matter, it's a department-wide matter that involves DTIC, it involves Department of Finance if they are going to increase budgets, it involves Department of Science and Technology if they can sell at a lesser price, it involved health. And so at that moment, it was not done. But for local manufacturing, we had now established a committee which had only one meeting, which is chaired by the president, to discuss what should happen for us to rely on local companies, even without the state-owned pharmaceutical company, which we believe we are not yet in a position to establish, even though there's an intention to do so. That state-owned company was even given a name, Kitlapela, but up to so far, it has never gone off the ground because of the reasons I told you earlier. That is going to be extraordinarily expensive when it's much cheaper to buy from those who are already well established. Thank you.
Thank you, Minister, for the response. Can I then hand over to Honorable Shira? You'll ask all the questions that we have, and then we'll give the Minister to respond, and we'll move in that order.
Ngiyabonga, Sihlalo. I think the minister must really just be careful in how he confronts or deals with this particular matter. It's either he is on the side of the portfolio committee that's raising valid concerns, or he's being misled by his officials that are found wanting in this particular case. Like now, Bamtshela ukuthi, financial capacity is not a requirement, when actually it is, and the NDOH, even at a national scale, in government, in provincial departments, request financial statements to be sent in before to evaluate a tender and if a company has the capacity to do the tender. Eyokuqala, Sihlalo, ukuthi uMinister, do they know as a department that Avaca was actually in the process of selling eBuzz and Innovata, the same businesses that are going for business rescue right now? And if they didn't know about it, why didn't they know? It means somebody was sleeping on their job. And right now I'm pointing this question to the DG. actually. Ukuthi, how did they not know as a department with such a big scale and large scale tender that these two companies that they gave a tender of 15 billion were actually being sold out because they were having business and financial issues? This is public information. You do a quick Google search, you find it at your disposal. Number two, did they not know? Because now the minister is speaking about the fact that they give a tender to various suppliers to mitigate a risk, right, of a supplier not being able to give out a tender. But these two companies are both owned by Avaca. They are both owned by the same person. So in regards to this risk management and spreading the board, I want to find out what the ratio was, particularly between Innovata and BAS, which are owned by Avaca Group, which is owned by Dr. Naik. So I want to find out if they did their due diligence in that regard as well. And number three, kuya kwaba ne-bidding committee entsha for this specific tender. There was a new bidding committee that was put in. The old one was removed. No reasons were said to that effect. We want to find out what are the reasons that happened. Number two, who are those people that they put in that bidding evaluation committee that came up with this botched tender, that didn't know that the companies that they're employing are actually going under business rescue? And number four, they removed the previous companies because of issues of collusion, right? So now if these two companies are owned by the same person, doesn't that raise an issue of conflict of interest? Doesn't that raise an issue of the very same collusion they're speaking about? What are the papers saying? What are the prices that these two companies gave in the tendering process to show that they were not in collusion? And you can't say they were not in collusion because they are owned by the same person. It's the same supplier getting a larger amount of the pie without any clear explanation on why that was done, especially if you have made it a modus operandi to mitigate risk by going in that particular direction. And eHetero Chairperson was one of the companies that was removed, by the way, on alleges or collusion suspicions and allegations. Fair as well. But now Hetero comes in and becomes the rescuing business to these two companies that are under business rescue. That must raise valid questions. How is it that the department missed this particular thing? You are removing one company because they are colluding, and then now that same company is coming in again to rescue the two companies that are going under business rescue. Honestly, the minister must come up with a much more tangible responses to how these things are happening under their watch, the DG especially. And then enye into Slalo, in this tendering process, BBEE was not applied adequately. And that is a concern. I mean, this is a matter that Treasury just lost in court not so long ago as part of the aspects that they've taken to court for. It's coming back up again in the NDOH. It was not applied, and that is basically breaking the law. And if it's not the case, the minister must take us into confidence and show us no, these two companies actually abide by BBEE. And if not, these were the consequences that emanated from that process, or these are the things that we supplied to be able to continue with this process, even if it is unconstitutional. We want to be taken into confidence because as it stands right now, kuba ngathi department is colluding with people who are doing wrong things. And the minister can't put on a defense face, especially if he says to us he's not involved in the tender bidding process. Then he must have the same questions that we have as well to the department, to the officials, to the tender bidding evaluation committee, to the director general of the department. He must be able to tell us or to be able to pose these same questions to these people that are supposed to oversee this process, and that was not done adequately. And then lastly, Slalo, we want to recommend that the SIU comes in once again, because we are of the idea that this is another corruption ploy, underplay by the people that are involved in this process, whether at a political level, because we can allege that, to say even at a political level, we've seen this happening. We saw it happening with Digital Vibes. It wouldn't be a new thing to even suggest that this is what is happening. So we want the SIU to come in and investigate the thorough details of what happened in this particular instance after so many red flags that occurred, and these guys still got a tender that they don't have capacity for. Their plants in India are already under DK, and the department doesn't know that. The department is not telling us that the very same companies, plants India, are under a process of being dysfunctional, basically. And that Hetero, the very same company they removed, is now rescuing these two companies. That these companies didn't have financial capacity, even though PFMA subscribes that these financial documents must be submitted to the reviewing committee in the tendering process. It's too many red flags. There are too many red flags for us to not be suspicious with what is happening with this ARV tender. It cannot be. And secondly, we recommend that this tendering process be started afresh. It can't be. The integrity of the department is under question and scrutiny, and it can't be on this particular scale, especially for such an important program. Ama-comrade mawafuna ukudla abayeke imali HIV nama-ARV. It cannot be acceptable that we allow this to happen. It's going to be the modus operandi if this particular process doesn't go unchecked. Those who are responsible for having botched this process, those who are responsible for having put a new bidding committee for this one tender, kumele sifake ama-googles manje and just scrutinize ukuthi how did it come to happen that all these things happened under their watch. Ngiyabonga Sihlalo.
Minister and team, over to you.
Yeah, Chairperson, as I've already said, 99% of the questions which were asked by honorable member are questions that I'm not able to answer. As I've already said, I don't get involved in the nitty-gritties of who gets a tender and how are they investigated, etc. The only one thing I can make, I'm aware that the honorable member who have just spoken has issued a tweet or an X whereby he believed the minister and the DG has eaten something and they must come and vomit it, meaning that there was corruption. For that reason, Chair, I would like to state it clear in front of this committee that I'll be very, very happy that you call the SIU, whether the SIU or the Hawks or whatever, to investigate the tender. I'll be very, very happy because I also want my name to be cleared. Because the honorable member by implication is that I must have done corruption on this issue, which is something that I hate with all my heart. So if she believes the SIU can come in and resolve this issue, Chairperson, I'll be the happiest person on earth if something like that was to happen, so that you go deeper to find out exactly who did what, so that the honorable member must stop thinking that I've eaten something which she says I must vomit. Thank you very much, Chair. Then the rest of the questions I'll give over to the team to answer.
DG and team, can you respond to the questions as raised by Honorable Shira? It's directed by your minister.
Thank you very much, Honorable Chair. I'd like to request the Chief Finance Officer to respond to most of the questions, and then probably Professor Chris and Khadija can come in. CFO?
DG, before the CFO, I think you also have questions to answer here as the person who finally signs. The committee will need to know where the DG comes in. As far as I'm concerned, when a bid has already been done, it gets signed through the process. The last first person to sign is the DG. It never comes to the minister for reasons that I've already said. So I don't have anything to check. So I believe before they come in, your part must also be explained, DG. It's very important for me. Thank you very much.
I agree with you, Minister, on that sentiment. The DG must take full responsibility for this as an accounting officer. So the DG is. So also to save time, DG, to save time, because I believe you were briefed by your colleagues when you were coming to this meeting. So the accountability on this matter rests with you, DG.
Yes. No,
you can proceed.
Thank you very much.
You should know what happened as an accounting officer.
No, thank you very much, Honorable Chair. Thanks, Minister. I thought I will come at the end. Yeah, the process is that firstly, we have, there are 3 committees that get involved. There's a committee that does what we call the specification. They do all the specs before the tender goes out. And then the second committee is the one that does the evaluation. And this is mainly the team of technical experts. Mainly in this instance, mostly the people in the pharmaceutical unit. There's the pharmacists, the pharmacoeconomists. They do all the work using the set criteria, which is 90-10, which is set out by Treasury because of the value of the tender. Once that committee has done its job, that committee then submits and make recommendations to the final committee, which is called the bid adjudication committee, which is chaired by the chief finance officer, and it's a standard committee. I must say that for most of the tenders, the bid evaluation committee is not the same. It depends on a particular tender, but the bid adjudication is standard, chaired by the CFO with a number of members who are at a DDG, chief director, and sometimes at the director level. So that's a committee then that finalizes and submit a final recommendation to the DDG for signing. Then when it comes through to me, I look through the documents. If I need any further clarity, I will take it back to the bid adjudication or call the CFO into the office 2 days. There's something I do not understand. That's why it takes a bit of time before I sign. And then I look at it, and if there's nothing that stops me from signing, I then sign off the bid. That's what happened even with this one. And I was very comfortable because the issue mainly I was looking at that we always get criticized on is the issue of the local production, which I was satisfied that we almost 70% of the companies that were awarded, they actually produce locally. So that's how far I can go, but maybe then with the permission of the chair, I'll still want the CFO to come in.
Yes, because you have generalized your responses, and I think the CFO is the chairperson of the bid adjudication committee, should provide direct responses to the questions as raised by Honorable Chair.
Yeah, thanks, Honorable Chair, and good morning to all members of the committee. Some of the questions DG has already clarified them. We have the 3 committees which they have applied in this case. The bid adjudication committee for pharmaceuticals, it doesn't change. It does change once a year or once in 2 years. But that committee that the DG has explained, it's made up of the technical colleagues from the provinces. So all 9 provinces, they send their representatives to be part of the bid evaluation committee. So that is the committee that goes through the documents. They check the due diligence. They check the samples of all items which have been submitted. And they make sure and confirm that all those products, they are registered with SAPRA, including other conditions which are included in the tender. So in terms of the triple PFA, as the member has indicated, we did use 90-10, as DG has said. So we did include the points under the HTI. So Kadisha can provide more details in terms of how much was allocated to local companies and so on. One, I will just want to explain lastly, I think one of the points that the member has raised, the issue of collusion. In the collusion, Honorable Chair, when you review the documents of the companies and you realize that the 2 companies that they have submitted a bid, they have been completed or the same directorship, like I'm the director on this company, I'm also the director on this company, and we are responsible for completing the documentation for the tender. So it means you do have the information from both companies. So in that case, it means when we talk about collusion, then you do indicate, or as you submit, one company, you might put the prices lower, on other companies, you might put the prices higher. So which will mean, as you submit for the company, you should not be aware of what is in the document of the other company. So the member has raised the issue in terms of the AVACA and the 2 companies that are involved. So in this case, you'll find that the directorship of those two subsidiary companies, they have the separate directors, which then it does indicate that what happens in one subsidiary, they do not know what happens in the other subsidiary. So in that case, then you do not conclude that there is a collusion. So I just wanted to explain, which it will be different in the other companies, which will normally go through as we go through the documents. Yeah, I think I've covered, maybe I can just allow Khadija just to provide more details in terms of those points that we allocate under the HDI. Honorable Chair, thanks.
Chairperson?
Yes.
Chairperson?
Minister?
My apologies, Chair. There's a question here, which honorable member said I was lying on the issue of getting balance sheet of companies, because she said I am lying because those balance sheet are wanted, and I said that's the information I was given. I would like the CFO also to answer that, because the honorable member said this this balance sheet have been wanted in other tenders, like a supply of equipment, etc. I would like the CFO to answer to that to that allegations before he sits down. Thank you. Unless there's any other
Yes.
person who is required to answer, but I thought it's the CFO who, as a chair of the bid adjudication committee, will understand what they require every time they adjudicate.
Yes,
Yeah,
Minister.
no, thanks.
Yes, Minister, because that's what I was expecting the CFO to talk to these issues, as you rightly so said. And then the CEO as well is doing what the DG has done. These questions remains unanswered. Yeah, that's the issue. Because
No,
the
thanks.
issue of Avacare as well, as she has raised it. Normally, the shareholding of the company, the other company won't know. I don't think it's a correct answer, CFO. Because you'll check on the directorship of companies, and it's all in the CIPC. That's the due diligence part the member is raising. Yes. Then the minister mustn't have to come back again on questions that they've got that are direct. We expect you as technical people to respond.
Yeah, thanks, Honorable Chair. Because I thought Kadisha was going to provide more details. Because in all the pharmaceutical tenders that we have in the national department, so we don't have that the review of the financial statements or the review of the balance sheet of the companies. So what the minister has said is true. And also just to explain, because also in terms of the tenders in the pharmaceuticals, we do award the tenders between 6 months and 12 months before the other tender end. So what has happened with the two companies, the tender was awarded around June, July. I'll just check the records clearly. But then you'll see that the media and the issues that we became aware was towards the end of the financial year. So at the time when the bid evaluation was doing the process, which was early in the year, we were not aware of any financial difficulties that the companies will have. But let me just allow Kadisha so that he can provide those details, Honorable Chair. Thank you.
Can I understand what is Khadijah's role in this whole process?
Khadija, she heads the pharmaceutical unit that is responsible for the bid evaluation committee. And she's also the member of the BAC. And she's the ones when they do the specification, because that's when we determine the requirements of the companies that should be awarded within the process.
Okay, she can proceed.
Good morning, Honorable Chair, Honorable members. Thank you for the opportunity to provide some information on this particular tender.
Chair, I'm sorry.
I'm only seeing your head, Khadija. Your head.
Yes.
Your head
Yes,
only.
she's cut. I was going to raise that. Yeah. Thank you.
Sorry, I can't see myself.
Yeah, it's
Okay,
fine.
now I can see myself. Okay.
Okay.
Okay. Thank you very much for the opportunity, and apologies for the presentation just now. I think it would be good if I started from the beginning, so people understand how we do things. As the DG and the CFO has said, there are three committees. There's the bid specification committee, bid evaluation committee, and then the bid adjudication committee. The way we've set up the committees is that there's representation from all the 9 provinces. So all the HODs nominate people to serve on those committees, the bid evaluation and bid specification, and they are then formally appointed by the DG as the accounting officer. Once the bid evaluation committee has evaluated a bid, it goes to the bid adjudication committee, as has been explained. This process starts at least 1.5 years, the bid specification starts at least 1.5 years before the contract expires. So there's a new contract, there's a contract already in place, and it's going to expire at a certain point in time. And we start the process to make sure that contracts are awarded prior to the expiry of that contract, because with pharmaceuticals, we know that the lead times are very long. So we give the new suppliers an ample opportunity to have their business practices in order so that they are able to supply on the first day that the contract starts. Just to address the appointment of the bid committees, the bid committees, bid specification and bid evaluation committees are appointed for a specific period of time. For example, it would be 3 years or 2 years or 5 years, whichever. In our case, those committees are appointed for 3 years. Their term of office came to an end, and therefore a new committee had to be appointed, and that is good practice in terms of how you appoint committees. It's good governance practice.
Okay, can I interject you on that so that you respond the answer? So
yes.
With this question that a new bid evaluation committee was appointed, when did the term ended? And because that's what we want, and when was the new appointed? So that you are specific on the dates, so that the member mustn't come back again.
Okay, so for the ARV tender, that process was concluded before the new committee was appointed, or the new committee started their work. So the award of the ARV tender was not affected by the appointment of the new committee.
Share the dates. When the last one expired and when the new one. Simple, straightforward issues.
Okay, I'll get the dates for you, Madam Chair. Just want to respond, and then if you give me an opportunity, I will go back and just look at the documents and revert to you later in the meeting over those dates. If that's okay?
Okay. Then focus on the actual question, not the whole process. Members of Parliament know that there are three committees in terms of the PFMA. They know that. They are aware of that. Focus on the questions directly so that you respond to the questions.
Okay, cool.
Without giving the history, so that we move. There are still more members and the time is limited.
Sure. Okay. No, I understand. Thank you. So with regard to the preference points, though, we do what Treasury has said is that the departments have an option to choose how they would like to handle the preference points. So they can use BBEE, or they can use HDI and RTP goals as part of their preference points. Now, in terms of our department supply chain policy, we have opted to go for HDI and RTP goal points. And in terms of that, the 10 points are allocated as follows. So those who have had no franchise in national elections before 1983 and 1993 constitutions, they are able to claim 4 points. If they are females, then they are able to claim 2 points. If there is a person with a disability, 2 points. And in the promotion of South African-owned enterprises, 2 points. So instead of saying we're going to use double B, triple E as part of our preference points claimed, we went for the HDI and RTP goals. And in terms of the points claimable, it's as I have mentioned in just a few moments ago, and that is aligned with the supply chain policy, and that is also aligned with the Treasury directive in this regard. So in terms of the business rescue, so the business rescue of Evercare was made public on the 9th of December. That was on the CIPC website. And we had awarded the contract already in August of 2025. So the business rescue and the information related to that in the public domain came after the contracts were awarded. In terms of the prices collusion, etc., So for us, in terms of evaluating the bids, we just need to have a suspicion of price collusion, and that was picked up by the team. In terms of the processes that must be followed, once we picked up this price collusion, we reported it to the Competition Commission, where the matter is still under investigation. We've also reported it to the Office of the Chief Procurement Officer, as well as our internal audit. So in terms of the suspicion of price collusion, which we have picked up as part of our tender process, we have followed all the necessary processes to address that particular matter. Madam Chair, if you can just help me if I've missed any specific question that's not answered yet.
The issue of hetero, Khadija.
The issue of hetero. Okay, the issue of hetero was about the reporting of the matter to the Competition Commission. So hetero was not awarded a contract for the items where we had picked up that. They have subsequently bought 78% of Bars Pharmaceuticals, and remember that is done through the business rescue practitioner appointed by the CIPC to be able to do that. So we have no influence on who the business rescue practitioner has selected to assist with the business rescue. In terms of the tender, as I said, they were not awarded because there was a suspicion of price collusion, and this matter has been referred appropriately. Just on the matter of Innovata and Bars being part of the Avocare group, so they are seen as two separate business entities. They're not related to each other, although ultimately they are related to each other as far as the Avocare group is concerned. The way they conduct their business and they select or how they chose to supply the medicines are different. So Bars has a local manufacturing site which they own, and from which they say they will manufacture and distribute, whereas Innovata has said that they will use a third-party manufacturer, such as Viatris, to manufacture their particular product, and then they will supply from that point. I just want to also note about the financial statements. Members may be aware that our pharmaceutical tenders were previously done by National Treasury, and we were part of that process. At no point in that time did Treasury ask for financial statements to be reviewed to look at the financial viability of a particular company. And we have taken over those processes from Treasury and improved on those processes. But even when the tenders were with Treasury, we did not look at financial information regarding a company. What we do look at is previous performance. And as Minister had said, we rely on our counterparts in the DTIC and Treasury to tell us if there's a signal that a company may or may not be able to perform because of any financial difficulties. Thank you, Madam Chair.
DPG, the clarity that one was asking, trying to assist you to answer the issue. The company called Avacare, as Honorable Shirwa said, has got a joint shareholding in both Innovata and Bars. And I'm happy that you have been in the department for quite some time. This is, they say, it's understood that the companies that had a common shareholding in the past, they were prevented from having the double bid. Now, why did this happen in this instance? The reasoning that you are sharing, because does it not increase this does not increase security of supply rather than to mitigate it? That's the question that I was trying to raise so that we don't come back, because I don't think you have adequately responded to that issue as raised by Honorable Shirwa.
Okay, Madam Chairperson, may I respond to that?
Yes, quickly.
Okay. So in terms of the directorship of the two companies, as they are registered with CIPC, there are no overlapping directors. Also, the source of their products are from different sources. So Bars will be making their own products, whereas Innovata will not be getting their products from Bars, they will be getting it from Viatris. And so they have different mechanisms. So there isn't really a risk in terms of between the two companies, putting our eggs in one basket, as it were, because they're coming from different channels, I could say, in terms of the supply. So their suppliers don't overlap. And there's no overlapping directors in terms of the directorship of Innovata and the directorship of BARS.
Before you leave, she also asked for the price difference between the BARS and Innovator to seclude collusion. No one responded to that question. I was noting her questions.
Okay, thank you, Madam Chair. I will look at that quickly for you. If you give me an opportunity, I may post it in the chat. Thank you. I do have it on hand. It's just I need to go and copy and paste it in the chat.
Yeah, you'll have to
you.
come back and respond to that question as Honorable Chira has raised it. It will be important. Okay. The next one is Honorable Clark. That order.
Sorry, Chair.
Yes, Honorable Shabam.
Thank you, Chair. I'm sorry to interrupt. I did not want to disturb the responses because at the time when the honorable member, sorry for my voice, I put a bit of when at the time when the honorable member was commenting and asking questions, I was struggling with my gadget. Chair, there are phrases that are unparliamentary. Honorable Chirwa mentioned that the minister is lying. And that phrase is unparliamentary. We can't live here with that the minister is lying because now it's continuing. As minister was responding, he indicated that the honorable member said, I'm lying, so I'll ask the members to the team to respond. I would suggest that the honorable member withdraw that phrase of lying. It's unparliamentary and it cannot be allowed to be used as if it's normal. Thank you, Chair.
Honorable Shiba.
Yeah, Sihlalo?
Yes. I believe the minister has indicated that whatever he was telling us in the meeting, he has been told by the officials. This is the report that he gets, and then the officials will have to take responsibility for that. The lying part of the minister to that effect. Because I think he has also made the emphasis, and we all know in terms of the PFMA, he doesn't sit in these committees. And now you see he's even quiet now because the responsible officials are here to account for their actions. But as a minister, he had to come and make a presentation. And once he make a presentation, he does that upon being given briefs. Yes, and the information that you are raising is very critical and important, as you've said that, and that's why we need responses from this official that were responsible for this. So that part of that, the minister was lying. We can clear that. Ne? Over to you.
Sihlalo, ngiyakuzwa, but I'm in disagreement because I referred to public documents, tenders that were done by the NDOH that required financial statements in order to peruse financial capacity and capability. And for the minister to have said that it's not something that they do, because he said they don't do it in the NDOH, it was not the truth. So he was misleading us. Maybe I should use misleading and untruthful. Maybe that way will be comfortable, but they mean the same thing. There was no truth in what the minister was saying. Because there's even a tender as recent as last year that required financial capacity to be proven by the bidding companies. And it's a concern that for such a big tender that they didn't follow this process or at least make it a requirement. And that is the point that I was driving to. If minister is taking offense on the word lie, I'll say, okay, don't not tell the truth. Stop misleading the committee. Stop presenting fiction as fact. Are those more palatable terms to use that mean the same thing as lie? If that is the case, then then please apply those.
Okay. So under the circumstances, I should think then lying is going above board. Misleading could be the most appropriate word. We agree, Honorable Shira, so that we can move.
Chairperson, I've got my hand up.
Yes, Minister.
Yeah, no, Chair, I don't want to waste your time, but lying and not telling the truth and misleading, etc., is not what I was doing. I've already said this is the information I got, and officials here themselves have already said so, that they were not looking for that, and I still maybe believe this question must be revisited. They've already said so. Khadija Jamaluddin, who is a chief director responsible for this, has said they've never gone to look for this financial statements. So when you say I'm lying, when the people who are doing that, they themselves have said so, it means you are specifically targeting me, honorable member, to believe that I'm misleading the committee. They've already said so, and it must be visited about where the truth, where the actual facts lie. But they've already said so that they've never ever looked for financial statements. And that's the information I got, and I've got no other reason to mention any other information. Thank you.
So the truth is that though it's a requirement, Honorable Shira, to look at this in terms of the tender documents, whatever, but the officials, they've said they've never looked at that. That it's on record. It's on record.
That is what I'm saying. I'm saying it is not true that they have never made it a requirement. I even referred to a tender specifically last year in 2025 in August that they did as the NTOH, and that specifically made a requirement for financial statements to be submitted, for financial capacity to be perused in the evaluation process. It's not me, it's their papers. And if they are maintaining that, it means those officials are lying not only to the minister, but to the committee as well. And I've raised this. I even cited the specific tender in question. I don't know why is this still a conversation, because clearly the officials are misleading us. That's the fact. The tender is on their website that requires this. I mentioned the tender. So must I join the misleading with them and mislead the committee as well when I'm trying to get accountability? I can't do that. It's their documents. They know that they've issued tenders where they've required financial statements. It's just for this particular conversation, it doesn't serve their purpose. So they won't admit to it. And that is fine, but that I don't carry that conscience with me. I don't share their guilt conscience with them. It's not my responsibility to lie on behalf of the department. I don't have to lie for them. They can mislead, but I don't have to lie. I've seen the documents. I've seen the tender bid. I'm going through some of them. Some from even previous years where they've requested financial statements to prove financial capacity. I don't know why they're acting like this is news, because they know that they do this. They must just say for this particular tender or for these 3, 4, 5 tenders, we didn't ask for financial statements. And then basically the question arises, why did you not? Especially for such a big tender. National treasure. I get that. I hear it. Even though it should be probed even much more deeper. But the fact that I raised this thing as a problem, it can't be the problem. It definitely cannot be the problem.
Chair.
Honorable Fison.
Chair, I'm sorry to come back again. I was actually not raising the issue to open a new debate. I was requesting Honorable Chirwa to withdraw the word lying. And simple like that, not to explain all the things that have been explained, just withdraw the word lying. It's unparliamentary.
Chairperson.
Yes, Sine.
Thank you very much, Chairperson. Chair, my hand has been up. I actually want to support what Honorable Khumalo is saying. Chair, is unparliamentary. Even in the House, when a person says to a member, he or she is lying, that member is always requested to withdraw. And all of us attended the induction when we started with the 7th administration. Chairperson, can the member withdraw the word lying? We just want the word lying. Thank you, Chair.
I did. I literally said replace it with misleading, not telling the truth, not being factual, telling fiction. I did.
Chairperson, I'm not trying to create a dialogue, but I did not hear the member saying, I withdraw the word lying.
Honorable Chair, for the sake of progress, can we do that you say the word lying, you replace it with those
I'm
other words?
replacing the word lying with telling fiction, with misleading the committee.
Okay, let's move. Let's move. We'll deal with that matter again later. Honorable Clerk, you were on the floor.
Thank you, Chairperson. I honestly think, that we really need to also consider time factor here. We have to leave by 12 o'clock because we've got to get to Parliament for sitting, and we can't continue drawing out our committee about issues. If things have to happen, it must happen, and it must happen with speed. If I can please indulge in that, Chairperson. Then in terms of my questions, firstly, I would like to highlight to the Minister that he is the executive authority over his departments. And if his departments are not complying to certain specifications, the Minister needs to be accountable for that. If I can just ask, they're saying that they didn't need to get financial statements, but in terms of the PFMA, you do need to get financial statements, and that is why we sit with so many projects. We saw that even with our oversight, where hospitals are standing derelict for more than a year and falling apart, new builds, because contractors have gone under business rescue. And it's something that really needs to be taken heed of in terms of financial misappropriation. It really is. I mean, and we also saw what happened with the oxygen plant tender as well. So for me, it is critical that financial statements are examined before we give tenders. And those financial statements of companies are public knowledge, so I can't see why it's not done. Then, just given that Hetero has now bought bars, how does it impact this contract? And as the Competition Commission investigation into Hetero drugs is alleging collusion, what progress has been made on the investigation? And if we could please get a progress report from the department in terms of that investigation. And then, what were the reasons that several well-established companies, including Adcock Ingram, Cipla, and Sun Pharmaceuticals, were excluded from the tender? And does the department have an update on Innovata, and what will happen to the contract now that the company is in business rescue? And then just in terms of clarity, in terms of the supply of ARV, the department states that there has been no impact on patients. How is impact defined and measured at facility level, and what evidence supports this assurance beyond national stockouts? And then my last question would be, did SAHPRA review, withdraw, or alter BAR's pharmaceutical certification either prior to the post-business rescue proceedings? And if so, what were the reasons for this? Thank you.
Straightforward questions. Who's taking them from the department side?
Thank you very much. With the Minister's permission, again, the issue of Hetero, the investigation is ongoing. We have not received a final report, and that is with the Competition Commission. That one. And then secondly, how do we assess the impact? In terms of the presentation of the Minister, we have systems in place, which is the RX solution, which is used in the hospital, and SVS, which is the stock visibility system. And we quickly checked, and we discovered that actually we had 5 months of stock, 3 months being in the depots of the provinces, and 2 months with the suppliers. So that's how we know that we're actually well covered during that period. But I will then request Khadija to go deeper and answer the SAPRA question and the issue of CIPLA, ADCOC, and other companies. Thank you very much, Chair.
Okay. Thank you, TG. Madam Chair, may I proceed?
Yes.
Okay. Thank you. So we really appreciate the interest in looking at the financial statements. Just to note that we are setting up a meeting with Treasury at the end of this month to see how we can do that, because we need to be aligned with Treasury processes. In terms of Cipla, Sun and Adcock Ingram, they were not awarded contracts based on the fact that their prices were outside of the acceptable range for which the contracts were awarded. So when you're looking at price plus points, they get total points. The suppliers that are ranked the highest suppliers are ranked highest points to the lowest. And unfortunately, Cipla, Sun and Adcock fell out of that range at which we would award suppliers. So for the one product, we awarded to seven suppliers, and the other one we awarded to 8 suppliers, and they were unfortunately the 9th or the 10th supplier in terms of the point scoring, and that's why they didn't get a contract. Then just in terms of SAPRA, and I'm sure this is related to the report that Bars Pharmaceutical, one of the production lines, has been evaluated by SAPRA and they've been shut down. So the way it works in the manufacturing space is that depends on your production line. The one that has been shut down by SAPRA manufactures liquids, ointments and creams. The one that will be manufacturing the ARVs, that is still SAPRA compliant, and they will be using that line to manufacture the ARVs, and therefore it's unaffected by the SAPRA investigation into the other line. Thank you, Madam Chair.
Okay. Under the circumstances, because of who's there?
Yeah, it's myself, Chair. It's
Minister?
myself. Yeah, I want clarity, because I don't want us to come here and talk about the same thing again. I've made it very clear that I put an arm's length between me and tenders and who gets tenders. But some members keep on coming back to me as the executive authority. For instance, Honorable Clark, I know that Adcock Ingram is a local company. Should I have overruled, for instance, if I had that a local company did not get this tender? Should I have called the DG or the Bid Adjudication Committee and overruled them and say, give this tender to Ingram because it's local? Will honorable members have accepted that? Or will they have said, maybe I'm eating something from Adcock? I want the position to be very clear, because it seems to be confusing me. I am paying an arm's length from tenders. If a local company doesn't get it, should I go to intervene and say you must give to Adcock? What does the committee expect of me? Thank you very much.
Okay, Minister, we hear you, and you have put the point around. Okay, what we'll do, because of the time factor, I would have preferred that every member asks questions and they are responded to. But because of the limited time, then what I will do, I'll ask everyone to throw their questions, and then we'll see post that how far do we go in terms of the time. Failing which those questions that members will feel they were not adequately responded to, they will then submit them to me again in writing, so that we submit them to the department for a full written response. I think, yeah, we've been communicating on the group as members, we've agreed to that. Then can I hand over to, that will also give the other colleagues who already asked questions an opportunity to make their follow-up questions if there are any. Honorable Mjadu, over to you.
Thank you, Honorable Chairperson, honorable members, Department of Health and the Minister. I will try. I've got 3 questions, Chairperson, that I want to ask the Minister. Minister, do we have the budget for these tenders as all health establishment have no budget based on the main provincial or NDOH account. Do these tender arrangements accommodate for individual drugs and patients who have a renal injury, impairment, who require individual drugs like tenofovir, abacavir, and other drugs? Does this contingency plan have accommodations for such patients that are variant in treatment regimes? And another one, do we have a plan to secure and have that production right for ARVs? If not, what are we doing about the manufacturing right? Since we are the highest consumer of this product, does it not make sense to be actively involved with trying to start our own manufacturing of ARVs to ensure proper steady supply, especially with TBE present states of risk of international wars? And another thing, Minister, I'm worried about this tender awards story because we're having a bad history in terms of awarding tenders to some of the companies. And Kabanguti Minister, maybe we won't answer this question now. Most of the time we found that politicians and officials are involved in tendering system, in a process. Do you think there are no brown envelope in this tender processes? Because we are still dealing with the history of COVID tenders, whereby the officials and the politicians were involved getting brown envelope from those tenders. I want to know who's benefiting from these tenders. Maybe you can ask me later, because you can tell us now you don't know, but after 5 years it will come to Parliament that politicians were involved, officials were involved. For the sake of time, let me end here, because Minister, I'm sure politicians and officials, they are getting something, brown envelopes. Maybe not you, but it will come maybe after a few years that the son of the minister, I'm making an example, and I'm not pointing to you, son of this person was involved. Son of maybe the maid of this minister was the part of this, was the beneficiary of this tender. So I'm getting worried, Minister, because you know what is happening now. Our committee used to say we follow the money. As we are following the money, well, we want to know if there's any brown envelope going to minister's son or official son. I'm making example, I'm not directing to you, because Minister, let me end here, Chairperson, because of time. Thank you, Honorable Chairperson.
Thank you, Honorable Mjadu, for minding the time. Honorable Van Staden, over to you.
Thank you, Chairperson. I will be quick. According to the group slide 11, your points in number 1 to 3, you spoke about uninterrupted access, implemented comprehensive measures, maintaining a resilient and reliable public health supply chain. As a previous speaker said before me, this department's got some bad history around tenders, like the digital vibe. But nevertheless, my question is, I just want to know what specific changes will the department implement to strengthen supplier vetting, oversight and risk management in future tenders? Thank you, Chairperson.
That was so sweet and short. You got the questions, ne?
And Mjad was short.
Yes. I doubt on that one. Honorable Mtobatse.
No, thanks, Chairperson. Thanks very much for the meeting. And also thanks very much, Minister and the team for the presentation. But I must say that as your officials, Minister, present, they trigger more questions than the answers. In particular, I'm looking at the story that they gave all of us, that there's no need, and they presented that to you, that there is no need for this information to be verified, but clearly PMFA requires that be done. And also, they do verify on this platform that they did not look for that information, which for me means that the ball was dropped, and this compromised the whole process. Would you? I think we must implore you to take the necessary action just in that regard, because dropping this ball is putting all of us, is throwing all of us under the bus, as the committee, as parliament, and as people who are responsible for the purse of the public. And we all agree that we have been misled, and we all agree that the the ball was dropped. And therefore, I want to implore you that the necessary corrective measures be taken in this regard. And I think you'll agree with us. And also request that a report in this regard be presented to the committee on progress on consequence management in this instance. That's my first comment. But secondly, Minister, I think you'll agree with me that India does not develop new pharmaceutical products, but focus on generics. And I want to go back to the issue that was raised by Dr. Letlape, which you explained. And you know that we can't postpone the establishment of a government pharmaceutical company. And that responsibility lies politically and otherwise. It lies with yourselves. That is on your shoulders. If anything does not move in that regard, you carry that responsibility. And I want to implore you, together with your colleagues in cabinet, that this matter be revisited and we be given regular reports on how we are moving. Progress is required in this regard. Which brings me to the information that you have been giving us, and the impression that you are giving us is that it looks like there are many local producers on this drug. And as far as we are concerned, there are only two. There are only two local companies, unless it is disputed, and you can give us that information. But then the point that I'm driving is that it is necessary. It is necessary that we move with the necessary speed and assist, because what normally happens, and which brings me to this question, that if we are talking about local producers or local companies, what does that mean? Because some of these local producers, in most cases, you find that they are being handled. And by being handled, I mean that they are big people, they front. Can you unpack the producers, local companies? What is it? Who are they? What do they exactly do in this regard, in terms of the improvement of local advancement of our people? Who are they? What is their ownership? What is their BE status? Is it our people? And how are they supported in this regard to make sure that we increase? And ultimately, we go to the end goal of the establishment of a pharmaceutical company. But then coming back to the presentation that was done, my sister there, in terms of the process, she says that there was the old and the new committee that came in. Now there's a lapse, and naturally, when there's a lapse, processes normally become compromised because the new normally does not know and is not aware with the process. Uh, can can the department revisit that particular process? That when the old comes in, perhaps maybe the old should finish what they've been doing, and when they are done with that, and then the new committee can continue. During this process, was that lapse? Did that lapse not compromise the process? And the minister should not go to, I think I've addressed that, should not rush into, we will come back to the SIU, but are you prepared to institute disciplinary measures in the department? Because you have confirmed you are not satisfied with the response, you become embarrassed. Are you prepared to institute disciplinary measures on whoever has dropped the ball? And if not, why will you not do so? Now, on what coming back to the process, not the process, but what verified evidence exists that alternative suppliers can rapidly absorb the additional volumes without compromising quality? And secondly, will the department commit to regular written reports to Parliament and to us as a committee on the ARV supplies stability for the duration of the current tender? Uh, and thirdly, how will the department ensure that risk mitigation mechanisms moving forward buffer stocks to include stronger financial, operational, and governance safeguards? I think those are the questions and my comments, Chair, on this particular matter. Thanks, Chairperson.
Thank you, Honorable Dugat. Honorable Sine.
Thank you very much, Chairperson. Let me show my face for proof of life, and please allow me to switch it off for network purposes. Minister, we appreciate the briefing on this matter. I'm also going to be short as some of my points have been raised. Chair, the minister reported that there has been no impact on patients with regard to this matter. So I don't know, how is impact defined, Chair, and measured at facility level? And what evidence supports this assurance beyond national stock data? Because I thought in the report, it will be explained per province. You know, you can't say there are no impacts on patients at all ever since this has started. So if we can just be clarified on that, Chairperson. And two, I want to know what structured mechanism does the department have in place to ensure regular and meaningful engagement with civil society and patients' advocacy organizations to avoid protests? You remember, honorable members, in one of the meetings that we had during the time of Dr. Domo, we had a protest of people living with HIV and AIDS. So what mechanism does the department have? Because I don't remember seeing any, regular engagement with civil society or community members as a whole. Thank you, Chairperson.
Thank you, Honorable Sene. Honorable Zungula. Honorable Zungula. Okay, proceed.
Okay, yeah, I was greeting everyone, Minister, colleagues, Chair. I'll also try to keep it very brief because I think, Chair, the biggest problem that we're facing here is how the sovereignty is basically surrendered. And because of how the department is either showing incompetence or collusion when it comes to some of the corrupt elements that we find in the private sector when it comes to having contracts with the state, because the department claims to have disqualified Terror for collusion, yet the very same tender they disqualified them for, they now own it. And this is as a result of the department failing to perform basic financial due diligence on bankrupt subsidiaries. Now, unfortunately, the door was left wide open for a banned company to become the sole savior. In my view, this is just corporate hijacking or collusion, incompetence, which is facilitated by the department that's very weak to do proper audits, and too toothless to blacklist. But I do want to ask, Chair, when it comes to the minister, his own understanding of what local is, because we hear a lot of the minister saying they are local suppliers. But what's your understanding of a local supplier? By means of an example, Aurabindo imported $46 million in the last tender, but is still listed as local. When I come to the morphine questions, whilst the department is bragging about having multiple suppliers for ARVs, 100% of our morphine powder supply is basically taken care of by one single struggling company. Basically, that company now has a monopoly on pain relief. And I just need to ask who then decided that there should be no backup plan for dying patients when it comes to the morphine aspect. And then on the TRV, how are the financial problems not picked up? The department's due diligence process include a review of the audited financial statements of these companies, parent company, which is Avacare? And if so, how did it miss such imminent insolvency? Because in my understanding, it is commonplace to audit parent companies in this case, and like it has happened now, the department failed to do so. The other issue is when it's dealing with SARPRA, because SARPRA flagged contamination risks at BAR's Cape Town facility in 2021, 23, and 2025, August 2025, which is the very same month which the department awarded them this multi-billion rand contract. And SARPRA did order a closure of the bars factory in September 2025, which is 1 month after the tender was awarded and barely 3 months before implementation. Now, the department chair has to answer why is there zero integration between what SAPRA inspects and orders closure versus the National Department's procurement board? Why is there no formal interagency red flag system that automatically disqualifies a bidder when their manufacturing facility is under a notice of non-compliance from our own national regulator? And what makes this, Chair, to be really sad and upsetting is that SAPRA falls under the department. So we're not even talking about an institution that falls in another department where, one can say it's interdepartment incompetence or there's no integration. You're talking about SAPRA that falls under the department, and the department is failing to pick up the red flags and failing to pick up non-closure, notice of non-compliance from the very same SAPRA that is under them as a department. And then when it comes to the foreign aspect, Minister, the government sector master plans and the PFMA emphasizes the prioritization of local manufacturing to build industrial resilience. Therefore, why is it that a 15.5 billion tender, the lion's share of that volume is awarded to foreign multinationals and their subsidiaries, while the established local South African-owned firms with proven delivery were sidelined or given marginal shares. Because I find this to be very problematic, Chair, because the department and the country will talk about how bad unemployment is, but at the same time, they'll go out of their way to give contracts to multinational companies who do not create jobs in the country. And local suppliers, they are given issues or they are sidelined when it comes to the procurement. And I just need to ask that, has the department abandoned its commitment to local industrialization in favor of the lowest possible bid price, from foreign entities? And then the last question, Chair, is about Kitlapile. It's so disappointing that in 2007, there was a cabinet resolution on the issue. We're sitting now 19 years later, there is still no localization or no state pharmaceutical company, yet South Africa procures or distributes millions of ARVs, whilst the price might have been hefty at the time, which is in 2007. Surely, as the company is growing and competence is being raised, it would get to an extent whereby the prices would even up and would not have a problem of having expensive production of ARVs. Now, especially when there is a set demand, because we've got an HIV issue that is dealt with via the ARVs. Now, the fact that there is no state capacity being built to deal with this particular problem, yet the competence is there when it comes to Kitlapile. However, you find that there's no political will. Maybe for me, it points to a picture of the department, some politicians, some officials actually benefiting from the destabilization of state capacity in favor of these foreign multinationals. And Chair, I think it's something that we need to raise strongly to the department to say we can't have a consistent demand for ARVs, but not care to build local capacity, state capacity to provide solutions to that problem, especially when there is competence in the sense that there is capacity from Kitlapile to do that. However, it's just that the department does not want to go there. I just wanted to raise that, Chair, that it is so disappointing. It's very disappointing that there is that, particularly in light of the high unemployment rate that we have, that is a crisis, and there's a solution to deal with that high unemployment rate. However, the people that are in power are deciding to put profits, to put their own patronage networks ahead of dealing with the crisis of unemployment and dealing with the issues of building state capacity to provide solutions to the problems that we face as a country. Thank you.
Thank you, Honorable Zungula. Honorable Dr. Liru, over to you.
Thank you very much, Chair, and thank you to the Minister and his team for presenting to us. I had a few questions for clarity around the presentation that was given. I think the first thing I wanted to get an understanding about was around that number of 15 billion rands for local, it would cost 15 billion rands more to do local capacity of ARVs. I understand that was around 2010. Was that 15 billion the cost for a state government pharmaceutical company, or was that what it would cost in terms of the tenders to buy ARVs over that year? And I understand now that we've got quite a lot of local private capacity. So I think, which as a contradistinction to a state kind of owned pharmaceutical company, my understanding is that capacity has been built over the last few years, and now we do have ability to have companies provide medication at a reasonable price that won't cost us too much.
Are you done, Dr. Liru? I see he's driving. Colleagues, can you hear me?
Yes, Chair, we can hear
Yes,
you,
Chair.
but we can't hear Leroux. It looks like he has disappeared.
Yes. That's the point. Maybe while we'll be coming back, can I then also ask the following questions? You will indicate to me when he's back. I should think then it will be important for us to understand how what's happening. Can you hear me, colleagues?
Yes, we can, Chair.
Yes, I was
Chair, we can hear you.
Okay, my apologies for that. Minister, we'll have to understand how this department conducts its due diligence, particularly when it comes to the confirmation of the shareholding of these companies. And then the other issue, because here we're dealing with the lives of people, one would like to understand what due diligence does the department conduct in determining whether manufacturers who claim to produce ARVs in South Africa are in fact doing so. For example, when the department does site visit, does it do so on days when the supplier is in busy manufacturing, or this can be witnessed as first-hand? Or does the department request batch manufacturing documentation once the manufacturer has taken place? That's my question, but let me allow Honorable Ru, I can see his back, then I'll ask the other questions that I have. Yeah, I realize you're driving. You might have been cut off.
Yes, thank you. I was just sitting in my car, but I for some reason got cut off. My apologies for that, Chair. My first question was basically around the capacity locally and whether those costs are still as high. The second question was around the processes that we are speaking about. The minister mentioned that companies don't always want to show their financials, but my understanding of companies are that most public companies need to, as part of the audit process and as part of the disclosure to shareholders, need to provide those to the public. So those should be available. And I would really like to urge the department to have that as part of their tender processes, that is actually part of what they look at to prevent the kind of things that we have seen today. The third issue is just around the supply that we have. Now, I'm really glad to hear that from what the minister reports, no patient has gone without ARVs due to the issue with these two companies that are basically going bankrupt. But my understanding, my question just around the 6 months or 3 month supply that you were speaking about, I'd like to get an understanding of what we are doing around the 6 month MMD and the 3 month MMD, because in that process, we should be giving patients 3 months at a time. And so my sense is that we should be having more treatment than that available. And I just want to understand what the processes that are being put in place to make 6 months MMD more available over the whole country to pretty much every stable ARV patient, and what kind of lead time and what kind of amount of treatment will be available. The other questions that I wanted to ask have already been covered. Thank you, Chair.
Thank you, Honorable Leroux. Yes, I hope my initial question was covered with regard to how the department does its due diligence. And then the other issue that one wants to understand, Minister, what data does the department apply to determine whether a product has been produced domestically or not? I think it's very important that we know that. And then towards the end of the slide, there is a bullet that says you have learned that Hetero has acquired one of the two companies, that is BUS, and that it will take over the supply through BUS portion of the awarded tender. But because the business rescue matter, but then we all know, Minister, that this Hetero is a company that has taken the department to court over the same contract, the one that was finally acquired by BUS. And then given that the department has also disqualified Hetero from the tender, now are you going to allow Hetero to supply on behalf of BUS, whereas there's a pending case against USA Department? because this statement, as listed on the presentation, it doesn't tell us what is going to happen. I think it will be very important for the officials to explain this. Then there's a slide that strikes me that if I leave it, the one that talks about you will have acquired an additional 15 billion to support local manufacturers in the tender process. Then I just want to get clarity, and maybe if you can do this breakdown for our benefit, it will be very important. We all as a committee have the understanding that this is a 3-year contract for 15 billion, of which the single product is the TDL, which will totally, if given, it takes the bulk of the budget, that is around 12 billion. Then it means then, under the circumstances, there is a slide that talks to the fact that then on this additional 15 billion, it means that you will have paid 30 billion or double the 3 contracts. I'm trying to get on the 3-year contract, because you know that TDL is the largest single item as depicted on the slide here on the allocation. I think it's on slide, on the one of the slides that talks about the contingency plans there. Then, and we all know that out of this TDL, it's taking to over 12 billion, then it means it's 80% out of the 15 billion. And then we all know that over 5.4 million patients are on TDL. And then that's the issues that is there. But then we would like to know then, under the circumstances, how has the department then arrived at this 15 billion additional sum it would have paid if these things were produced locally. To my understanding, I believe there might be some local, looking at the previous tenders, which Honorable Clark asked of the others that were said they didn't meet the requirement. Locally, then this capacity could have been met. Then the issue on that, the issue that one want to emphasize, which the other one of the colleagues raised as well, you've stated that you are procuring at least 70% of the ARV from local manufacturers. And then when you assess the documents that you have given us here, the 80% of TDL in the contract value, then I'm trying to look at these companies as listed here that you said they are local, and they are, when Googling them, because this is the information that you get also in the CIPC data and the related documentation. You look at MK, that is, it's coming from India, but here it's written as local. Then if you check documents on the internet, including your Indian custom and excise sources, it indicates that MCO, they import the IRVs into South Africa from India. For example, if you check in the last 3-year contract that ended in 2 months ago, you will pick up that MCO imported over $43 million or 1.6 billion ARVs at the exchange rate at the time. Yet the department still lists MCO as local when they are in fact importing ARVs. And then you look again at that slide, Minister. The department also lists Innovata, BAS, Oribindo, and Viatris as local and not importers. But if you to check the other information on the India custom, it indicates that Innovata, Oribindo, and Vatiso are importing ARVs into South Africa. And then similarly with BAS, they've not yet even concluded their technology transfer to manufacture TDR. How can then they be producing in South Africa? Moreover, BAS, as a consequence of going into business rescue, have been acquired by Hetero, who will import the ARVs, because also Hetero he will be importing the ARV products into South Africa. So you look at this ARV tender of the 7 company, the same applies on the 28 pack of TLD. Then maybe as we do that, can we ask the DG and the team to break down on how did you arrive at the minimum 70% when the import data for the above supplies indicates that you are importing into the country? On the same basis, can the department also provide an alternative import data or any other manufacturing documentation that indicates that these manufacturers are producing locally? And I want to also understand that maybe you can clarify us, because as far as one understands local manufacturing, if you read the documents, local manufacturing is defined as the formulation, packaging and labeling conversion at a local manufacturing site in South Africa. It specifically excludes the importation of premixed products, granules or packaging or labeling. So that's the issue that I want you to also then, as you do that, explain that. I won't deal with the issue that Honorable Clarke raised on the others, because when you were studying this, you had to look at what happened previously on the exclusion of the other companies that. But the question is it that when you excluded those ones that were local in favor of importers, what was the reason? Because normally you'll hear the president also talking about this issue of the us support our government intention to strengthen domestic pharmaceutical manufacturing and to lead the African Union's regional manufacturing objectives. And the president of this country, including the president of Kenya, they are the ones that are spearheading all this issue of local manufacturing. But you look at these decisions, then it's contrary to what the president, our own president, is championing throughout the continent. And then, because the issue is that but we'll have to ask to say, for the department to have been disregarded those other companies that were producing in the past in favor of the companies that majority of them mainly they are coming from India. There should have been rational issues, because when you do your poll scoring, you also look at those things. I've heard Khadija saying something, but still, it doesn't make sense. The other issue, as I was reading through, when you want to check your previous contract, Minister, your department following the court proceeding, you have excluded and reallocated Innovata's contract to other suppliers. Now, I want to ask the question, why will then the department award a company with a new contract when it was previously removed from the previous tender? So this is something that when raised doesn't add up. Then the other issue that I want to also get clarity, Chair, the officials they are saying that in particular, it's Khadija who said that in your general terms and condition of contract, you can consider preference for local manufacturing. Maybe also on this one, DG, can you explain how you apply this local preference and what percentage premium, if any, that you have applied for the local preference? Because the issue that what comes in, I should think, if considering the country's fiscus, it would have been be better off if the department had paid a small premium and preference, for example, for paying the 28 packs to the full importer, Farmer Dynamics, as provided in the slides that you have indicated. So I think you need to also check with us to say, what is the value proposition to that effect? And then the other slide that I checked, which is my last issue, Minister, in the presentation, it is stated that the tender was intentionally awarded to multiple suppliers as a risk mitigation strategy. And then when I go through this, it doesn't seem to be the case. Maybe if the following is explained, then it might make sense. I'm trying to look at the slide that deals with the 7 companies on the ARV tender. For the 28 packs, 8 suppliers have been awarded. And then when one analyzes all these 8 suppliers, one finds the following. You look that MQ Pharmaceutical is an importer which has collaborated with BAS, who, as whom, as I said earlier, they have not completed the technology transfer from MCO, and therefore it means then MCO will be importing their allocation as well as that of BAS. Furthermore, you look at this, you'll realize that BAS have gone into business rescue. And then when you do the calculation as per this slide that is before us here, you'll pick up that the combined tender share for the 28, it will between BAS and MCO is 26%. You look also at this company called Vitris. You can see they have collaborated with Innovata and the two have a combined share of 24.5% if you are to look at the tender amounts. Then when you look at this, to me, these 4 suppliers that I've mentioned, they've received an over 51.2 share of the 28 packs, yet they rely only on 2 suppliers, that is MCO and Vitres, for the full 51.2%. And then Honorable Shirwa has said this earlier, what makes matters worse here. The entity Avacare has a joint shareholding allegedly in both Innovata and BAS. And then when you talk about risk mitigation, this cannot be seen as risk mitigation strategy. Because also looking back, because Minister was talking about the same officials who were there in the previous bids, the department has disqualified companies with common shareholding that bid for the same product. But you see it happening here. Can the department explain now why didn't it then not disqualify Innovata and BAS due to the common shareholding? Why now? Because in the past you have done that. And then one will want to get clarity also to say what risk mitigation has the department applied in the case where Avocare was a common shareholder in the 2 entities that both won the contract? And lastly, Chair, you look for both the 8490 of the TDL. There is a picture that one picks up out of this. You look between MCO, Vitris, and Innovata and BAS. If you calculate the percentage of all this thing, they've collectively got the 58.7% share of the 84 packs. The same factors apply where the supply will not only come from 2 companies. And then I just want to understand, or maybe the department can explain how this risk mitigation, how this is risk mitigation to ensure security of supply. Then the common shareholding of Overcare on Innovata and BAS, it applies in the 84 spec. And can the department also explain why these 2 companies were awarded respective contracts? Is clearly the supply comes from the 2 and not from the 4 companies, as I indicated earlier. Then when you reflect on this data, maybe the department is in the best place to explain to us if it still believes that the awarding contracts to Innovata and BAS is appropriate risk mitigation, and whether the department intends to rescind the contracts of both BAS and Innovata and relocate these contracts to the existing ones. So that those are some of the issues as one go through these documents, the anomaly that one picks up. Maybe if then responded to, the confusion in my head will then maybe a bit subside. So basically that those are the issues that I don't think I omitted any other member. Yeah, over to you, Minister, and the team, and we're mindful of the time, but you can attempt to respond to these questions until 12. Then if there are those that are outstanding, then I believe the officials were noting and the members will again send them to me so that we package them and send them to the department for a written response. Over to you, Minister and team. It's a lot. That's why I was trying to ask each member to ask and get responded to.
Thank you very much. I will pick up those I can and leave the very technical ones, and I think there are many, to the officials who have been dealing with the matter. There are three questions from Honorable Mjatu from MK Party, whether we have got a budget for these tenders and variants. And I think I'm also leaving that to the officials, but my understanding is the answer is yes, we do have, because while people are on ARVs, they are not on the same ARVs. They are on different formulations. Some have already gone beyond the first stage because of resistance, etc. So all of them are budgeted for. The next question from Honorable Mjadu is whether a plan for production rights of ARVs to ensure proper supply. I think this is the one I've spoken about before, of establishing a state-owned pharmaceutical company. Chair, when you establish a pharmaceutical company, all we have to do is, after establishing, all we have to do in health after we've established that company is to see if the regulator has passed the product they've manufactured. If they've done so, then we can acquire, we can buy from that company. I do agree, honorable members, that there is a bad history of tenders in the department, and this has already, sound the name of the department. I know about digital vibes, etc. Now, Honorable Mjatu is asking if I can confirm that there are no brown envelopes from this tender process. I can confirm that there are no brown envelopes as far as I'm concerned, even though you said you are not directing it to me, but you many times mentioned whether the minister's son or the minister's daughter or the minister's whatever has not get anything, whether it will not arise in 5 years or 3 months or whatever. I can tell you with no equivocation that if that happens, it won't be pointing to me, because I have nothing to do with it. I am saying so with all the confidence in the world that whatever comes, whatever investigation is done, I won't be involved in brown envelopes. I cannot speak on behalf of officials who, not because I don't trust them, but because I can't speak for them, because I do not know whether any brown envelopes were passed. As far as I'm concerned, from my side, I've got an arm's length, and none whatsoever of my relatives, as far as I know, has got anything to do with these pharmaceutical tenders. So I can assure you that there's no brown envelope on my part. Let's look elsewhere. And if you find it, yes, action ought to be taken. That is why when I jumped to the issue of SIU, yes, it's because those are the law enforcement agencies that are able to investigate brown envelopes. Yes, we don't have that capacity in the department. Law enforcement agencies do that. And you know that SIU has got a very good history in that regard. Honorable Van Staden, yes, we heard you very well about risk mitigating measures for future. Yes, that's how government works. If something went wrong the previous time, when you do it for the second time, you look at what went wrong and you put a mitigation measure. Honorable Mutubatsi, you mentioned the issue of balance sheet. Yes, they'll respond to it again. And the issue of consequence management. Now, you mentioned that India focus on generics. Yes, it's true. Most of the originator companies who investigate, research the formation of a drug, etc., are definitely mostly from America. India is manufacturing generics. That's why at one stage it was called the pharmacy of the third world. That's what India was called, because most countries which in the past were classified as the third world, most of which are on the continent of Africa, are buying their generics from India. And you remember, honorable members, that in the past, intellectual property was forever, but it was changed in 2005. It was changed at Uruguay to make it for 20 years. I'm not sure whether it's 1995 or 2005, but it was changed that an intellectual, a company that manufactured a particular product can only have intellectual property rights for 20 years, after which anybody can manufacture that product. And when you manufacture it, it's called a generic. And it's cheaper because you did not spend any money on research and manufacturing costs and all that. I mean, research costs and all that. So generics are the ones that are saving our people all over the world, especially in poorer countries. Now, you mentioned, Honorable Mutubatsi, that the minister carry a responsibility of establishing a state-owned pharmaceutical company. And the answer is no. I don't carry that responsibility. I told you long ago that the Auditor General outlawed that, manufacturing must happen in another department, because the Department of Health is the beneficiary or the consumer. So if anything must be established, it can be the Department of Health. That has been abolished long ago by the Auditor General, and that's why it's taken over to the Department of Science and Technology. And we work very closely with them. That's why BioVac, which initially fell under the Department of Health, was transferred to the Department of Science and Technology. The issue of the old and new committee, Khadija, I believe you must give the dates, because you explained it, but it's clear that honorable members did not hear it very well. It was not explained well as I was listening, because I thought you said the tender was awarded before the new company came in. So the old completed the process altogether. There was no lapse. And after completing, the new company came in. But you can only prove that by giving the dates. I hope you have already checked on the dates. The issue of an evidence that whether suppliers cannot compromise quality. Chair, I'm sure you are aware that all the drugs that we buy have been certified by SAPRA as the regulatory authority. And in certifying, they also check on the issue of quality all the time. That is their job, because it's their competence. We don't have that competence in the department. If SAPRA say this is okay, you can buy from, then you do. That is why, Chairperson, nowadays, countries no longer rely on one regulatory authority. The regulatory authority comes together to sign memorandum of understanding. That's why we have SAPRA has got a memorandum of understanding with European EMA, European Medicine Authority, and AMA, the African Medicine Authority. All those things they sign so that they share information about the company, such that if a company is registered in one country, when it comes to apply in your company, in your country, in the past, regulators used to start from the scratch. Now they longer start from the scratch, because they share this information all over the world. And that is the best practice that is taking place recently. Honorable Sin, you ask a question which also Honorable Clark asked about the impact on patient, which we have already answered. And it looks like maybe we are not answering it adequately. Yes, we believe there's no impact on patient, because we know our patients who are getting ARVs, we know where they get them. And there are three ways of measuring whether there's impact. It is when a patient come back and say, I didn't find ARVs because a company did not supply, or when a patient is offered alternative ARVs because what they are used to be on is not there, has not been supplied, then we know there's been impact. Or when a patient does not receive the number which is they are usually given, for instance, whereby a patient receives a monthly supply and is told that we can only give you for a week, you'll come back again because there's nothing. We have never experienced any of those. That's why we believe there's no impact. As far as patients are concerned, they've got all the ARVs. If they never got them, it will be any other reason which we don't know of, not the reasons of this business rescue, a problem that has happened. So up to so far, we're very comfortable about that, and that's why we are sure that there's never been any impact on patients. If there is any, it's not because of business rescue. There are many other local factors. And that's why we have got SVS and we have got RX solution to check that those local factors do not affect us. That there's no engagement with civil society. Honorable members, I want to clarify this. Our war against HIV/AIDS is not fought by government alone. It is done through SANAC, as you know, South African National AIDS Council, which has been established long ago. And whoever is the deputy president of the country becomes a chairperson of SANAC. Civil society also come together and they choose a chairperson. That chairperson of civil society deputize the deputy president. We report to them, and civil society in South Africa, or SANAC, has got 18 sectors, all in all. In the sectors, we have got academics, you have got researchers, you have got unions, you have got people living with HIV and AIDS, you have got business, you have got the state, you have got many, many people. And all in all, they've got 18 sectors who are represented in SANAC plenary. And we take these things to SANAC plenary. Even after PEFA pulled out, we went to SANAC plenary to account to them whether this thing is going to affect patients or not. And we meet them all the time. So it is not really true that we don't engage civil society. We engage them very much because I, as the minister, in the same way that I account to you, I account to SANAC plenary and the chairperson of civil society who deputizes the deputy president. I account to him because both of them are in a way my bosses. So there is no way that we can ever go on to fight the war against HIV without involvement of civil society. It's not possible. Honorable Zungula, I think this hetero thing needs to be explained because as far as I'm concerned, hetero bought a company that has had gone under business rescue. So meaning that that company, because it's bought, it is the one that is supplying, not hetero. I believe hetero supplied it with money, in my understanding, but officials will clarify that. Now, hetero was not disqualified for not having money. It was disqualified for collusion, for what they call collusion. And that matter is still under investigation by the Competition Commission. And hetero itself has taken us to court. The matters will be ventilated there. They were not saying hetero, you don't have money, or you are not rich, or you can't rescue another company. They were just saying what we have done in terms of the rules. You have to be disqualified. And in my understanding, if they did not disqualify hetero, and the committee here, the portfolio committee found that hetero did something that is against the rules, I think it was going to be another issue also. The department was going to be questioned why they left this company even when it did something wrong. So at the moment, my understanding is not that they've been given back the tender. They've bought a company which they are giving money to, and that company is the one that won the tender and is still supplying. Officials, please confirm that. The issue of no backup plans for morphine, I'm sure Khadija, because he's dealing with these things, will report. But in as far as I understand, you only do backup if there's a different company manufacturing the same product. If the product is manufactured by one and only one company, then there is nothing called backup. You've got to buy from that company. But I also want Khadija to confirm that. The issue of SAPRA flagging a particular company and why we are not engaging with SAPRA, I'm sure Khadija will also explain at what stage does SAPRA come in. Local manufacturing is emphasized and we're sidelining locals. The issue of Caterpillar is mentioned in political will. Honorable members, I tried right at the beginning to explain this issue. It's a choice for us. And if you were in our boots, you realize that the choices are very stark and difficult. The choice in health is whether to supply all the people, millions of people who are on ARVs, using the budget that has been allocated by us and passed by this honorable House of Parliament. Now, if we are given 2 billion rand for ARVs and this budget is passed by Parliament, and we found that in order to go and buy ARVs inside the country, you need 5 billion rand. What do we do? What do we do? It may mean that we treat half the number of people. If you are supposed to treat 1 million people, you treat 500,000. If you are supposed to treat 2 million people, you treat 1 million. That's the choice which I gave to COSATU 15 years ago, as far as I'm concerned, when they were confronting us on this issue of local manufacturing, that as a country we need to make a choice. Is our choice to create more jobs and let more people not be on treatment? In very harsh language, is our choice to create jobs at the expense of life? And in the Department of Health, we always choose life. And we say we want our people to live so that they can live one more day and get jobs that get created in future, rather than take all the money and say we are creating jobs here and let people die. Our choice is to make people live. It's not that we don't have political will. Honorable Leroux, and I think the chair also raised this issue, 15 billion rand, and maybe I confused you. This 15 billion rand is the money that will have been needed over a period of 5 years. Around 2010, at the time when we have just launched the world's biggest HIV counseling testing, when we projected the number of people who need to be on ARVs and look at the prices locally, we found that we're going to need 15 billion rand in a period of 5 years in order to give all the people who test positive for ARVs. Remember, in the beginning, we're not giving ARVs to everybody. We're choosing those who are about to die with a low CD4 count and those who were pregnant with a CD4 count of less than 350. I'm sure you might have forgotten those figures, or some of you were not in the field to remember them. Now, when we started that HIV/AIDS counseling and testing, we were going to give ARVs to people who are HIV positive, full stop. And looking at the numbers of people who were testing positive, who were in millions, we calculated that we'll need 15 billion rand extra. We did not mind that, provided Treasury gave that money. We could not have had any complaint about buying locally if we were given 15 billion, but we're not. And the Minister of Finance came to that meeting to make it clear that it's not going to give us any more 15 billion. We've got to work with what we have. So again, we had a choice. If we work with what we have, do we choose to treat lesser people in favor of manufacturing here at home, buying here at home, and hiring more people? The choices are stuck for us. And I'm repeating, in health, in the Department of Health, we'll always choose life over anything else. That's what has always been our guardian angel. And when we chose life, we realized that we've got to buy generics elsewhere, which will make as many people as possible to live. Honorable Chairperson, on the issue of due diligence, you mentioned many technical issues, which I think the committee will report to. Honorable Leroux, you mentioned 6MMD. It is one of the areas that were not compromised. You are aware that we started 6MMD late last year because in 2024, in December, on World AIDS Day, people marched in East London to the Deputy President and demand 6MMD because we're doing 3MMD. In other words, we're giving a 3-month supply of ARVs. They said they want a 6-month supply. And we agreed with them that day, and we started implementing the 6-month supply. It is still being implemented, and we don't think anything has affected it up so far, at least not to my knowledge. I want to assure you, Chair, that at the moment, the ARV tender cost is 16.5 billion. And I'm sure it's a figure for now. The 15 billion was not what it cost then at that time. It's what was wanted in addition if we buy locally because of the prices. They are not like the price in India. And I told you that India is cheap because they've got different set of labor laws than us. It's not that we're selling to them. It's because they are in a better position, especially because they also manufacture APIs. There is no single South African company that manufactures an API. API means active pharmaceutical ingredients. All of them are ordered from India. Not a single company based in South Africa is producing APIs, and we have challenged them to try and improve from that. So at the moment, India still have an upper hand, and not only in South Africa, on the whole continent. That is why it's called the pharmacy of the third world, as I've said before. Honorable Chair, you are right. Our own president is encouraging local manufacturing. He's not the only one. He's working with other heads of state. In fact, over the weekend, I attended the AU meeting. I was sent there to represent the president in one of the meetings where heads of state came together to launch something called Achieve, put up mechanism, and there were a lot of scientists there, even from South Africa, about how we are going to achieve this issue of local manufacturing. It's not as easy as honorable members are putting it. We want it to happen all the time, but it's not always possible because many of our companies do reconstitution, repackaging, etc. They don't manufacture products from the beginning. I've told you about BioVec. BioVec is a South African company that is 53% owned by the private sector in South Africa and 47% owned by the state. They provide childhood vaccines, but even them, they reconstitute products from somewhere. They don't start from the scratch. The only vaccine which they are going to start from the scratch is a cholera vaccine, which late last year they launched clinical trials, which are very promising. We launched clinical trials at Chris Hani Baragwanath Hospital with all the scientists and researchers of the country, with the Medical Research Council, because for the first time, BioVec has been able to manufacture a molecule that will lead to a cholera vaccine. Otherwise, all this time, our companies do not have that capacity, even private companies in South Africa. That is why, even with lenacapavir, the preventative injection that is coming, we had a similar problem. The originator company is Gilead in America, which is selling it for 28 billion, which nobody can, $28,000 rather. I'm sorry, not billion, $28,000 rather, which is about half a million South African rands. Nobody can achieve that. So Gilead was pressurized internationally not to let people die, but do something about it. So they gave up their 20-year intellectual property and gave what you call a voluntary license. That means give a license to other companies who can manufacture the same product before the period of 20 years passes, meaning they are giving their intellectual property in favor of life. And they've done so, but under pressure. Now, 6 companies were given that voluntary license by Gilead after assessing them. I'm sorry to inform you that none of our South African companies was given that license because Gilead says they don't have capacity. We are still trying our best. That one of our generic manufacturers is still negotiating, but the Gilead said they don't have capacity. And the companies that were given were all from India. Only one is from the African continent. One in the whole continent of Africa, among all the countries, was given that voluntary license. And that company is not in South Africa, unfortunately. It's in Egypt. That's the only one which the Gilead said will give them a license because they've showed capacity. And when we said, what about South Africa? We are the biggest consumers. They said, no, none of your companies have got capacity. We don't know how far true is that, But these are the facts that confront us every day. And so when presidents meet at their level, it's because we ask them to take over. Honorable members, this is an issue much bigger than health. It is. When I went to the president to ask him to chair a meeting between Treasury, Science and Technology, DTIC, Department of Trade, Industry and Competition, and Health, is because when I went to these sister companies, they were saying, no, health must buy local, you must see to the finish. And so I told the president, here, Mr. President, Treasury give us 2 billion. I'm giving an example. They give us 2 billion, they say, see to the finish. We've got 3 million people, I'm also giving an example, who need this drug. And in order to cover it for 2 billion, we have got to buy at a particular price. And such a price does not exist locally. What do people expect of us? Our primary job in health is to make sure that people live and they are treated. The primary job of trade and industry is to create industry and create jobs. The primary job of treasury is to make that possible. So I said, Mr. President, it can't be that our sister departments put this on the shoulders of health alone, that we must see to finish alone. We won't be able to see to the finish. What we'll do is to buy the cheapest in order to treat more people. That's why many people are alive today. That's why life expectancy went up in South Africa. It's because people who needed ARVs got them. That's why maternal mortality dropped, because maternal mortality used to be the highest because of HIV and AIDS, honorable members. So please understand our position. And we believe the head of state and heads of state in Africa must come together to help us solve this conundrum of local manufacturing vis-a-vis prices, vis-a-vis the budget that is given to the Department of Health. Chairperson, I'm leaving all the others to the officials. Thank you very much.
Thank you. Thank you through the chairperson. The minister has covered most of the questions. I'll just add on the issue of the question from Honorable Njatu on the budget. Yes, we do have the budget. And in South Africa, we have an annual HIV conditional grant of 25 billion, which is actually ring-fenced. Part of that money is used to procure the ARVs. Let me then leave the others for Khadija, as the minister has mentioned. Maybe Professor Chris will start and then Khadija will come in. Thank you.
Thanks very much, DJ. Thanks again, Minister, Honourable Chair, and Honourable Members. Just a brief addition on where we are with the question of local manufacturing, because I think it's very misunderstood. As the Minister has made quite clear, is it's not a primary function of the National Department of Health to manufacture medicines. We purchase medicines, but because we are the largest purchaser by volume, nowhere near by price, we only purchase about 28% of the price value of medicines in South Africa. We are a big player in the space. And when the Honourable Minister went to the President and put the 4 departments together, it became a challenge for us as the 4 departments to try and understand better what's going on. There is an interdepartmental committee that has already done substantial work on documenting who the players are in the space and where the low-hanging fruit is, who should take responsibilities for what, health's responsibility both in the department and SAPRA, trade and industry for facilitating the tech transfers, because we don't do those kinds of things, trade and industry for creating the industry framework which will make it possible, and so forth. So that work is ongoing. We report to the Director General in the Presidency on progress, and there are at this, I think the next meeting is coming up within the next week or 2, where we will report back on the progress to date. It's not a straightforward matter of just manufacturing the medicines. Of course, when we define a medicine, we must remember that for a chemical compound that we talk about the active pharmaceutical ingredients, and many of those are the raw products the Minister was talking about that are brought together into a manufacturing process to make that API. APIs are not made in South Africa. So even the companies who say they are local manufacturers, they are importing the APIs. But what they are doing is they are manufacturing the tablets, the capsules, the injections, and whatever using that API. And for the vaccines, it's a biological product. We call it drug substance. Again, as you know, we are trying very hard to get drug substance manufactured in South Africa, and there are various initiatives for that. But in the meantime, we mostly import our drug substance. And again, it is bottled here, put into the vials, and so forth. We are working with other African countries. We're working across our borders, particularly in SADC, with getting larger volumes and working across Africa to determine where the nodes would be, where local manufacturing for the whole of Africa should take place. So there is a huge amount of work taking place. There are other entities other than the 4 departments are involved, and we believe we are making some progress. But let me hand over to Khadija for the technical details that were perhaps to expand on what the minister's already explained. Thank you.
Thank you. So just in terms of the bid evaluation and bid specification committee's appointment, that was done on the 1st of April, but the old committee, the outcome committee had already completed the process and made their recommendation to the BAC. So there wasn't a time lag between the 2 committees because the old committee had handled the entire tender process for the ARVs. In terms of the morphine for bars, so Minister is correct. When you have only one supply in the country, there is no risk mitigation in terms of awarding to multiple suppliers. So unfortunately for us, Bars is the only manufacturer of morphine powder in the country. I just want to also mention, and again, the regulatory issues related to SAPRA and Bars. I just need to explain again. So Bars has 2 manufacturing lines. One is for ointments, creams, and liquids, and the other one is for tablets, the oral solid dosage forms. The line that was shut down by SAPRA is for the ointment, creams, and liquids. The line that's still compliant with SAPRA is the one where the tablets are made. And then just in terms of the 6MMD and the demand planning, just to reiterate what Minister said, that demand for 6MMD is included in our expected demand. And so that the numbers are correct. Just in terms of the due diligence questions, yes, we do site visits to the suppliers. But oftentimes we have to give them notice when we are coming. Just to reiterate that all the suppliers have 2 manufacturing sites on their medicine registration certificates. And when they say that they are a local manufacturer, they put in their bid response documents that they tell us in their bid response documents that they will be manufacturing locally. So it may be that you have, for example, Aurobindo, who's an Indian manufacturer, but their product is actually coming from Rapsa that's situated in Centurion. So they may be an Indian manufacturer saying they're exporting to South Africa, but a lot of the Indian manufacturers, as listed in the documents that we have provided, have indicated to us that that manufacturing will actually happen in South Africa. And one of the things that we will be asking, thank you, Madam Chair, for raising that, is the batch certificates, batch manufacturing documents, to confirm that they are indeed manufacturing locally, and that is something that we'll be implementing in this tender. The other questions, I think Minister has adequately answered. If there's something I've missed, please, we are keen to get your written questions, which we will respond to. Just in terms of clarifying the bad history of tenders in the department, I'd like to give the committee to note that as far as pharmaceuticals are concerned, we have never had an audit finding for more than a decade. We have the most stable supply chain in the world as far as ARVs are concerned. And if you reflect back to COVID period, South Africa had the most stable supply chain, among the most stable supply chain, given the supply chain disruptions globally. Just also to note that because of the way we do our planning, the supply planning, demand planning, and the way we manage our manufacturers, we have the best prices for ARVs in the world, which then allows us to provide treatment to the large number of patients we have in our program. Thank you very much. We've taken a lot of lessons from the committee members in terms of the due diligence, the financial status investigations of companies, and certainly we will work with Treasury to make sure that those checks and balances are in place in the future. Thank you, Madam Chair.
Chair, Chairperson?
Yes.
Yeah, no, just one small thing. In my understanding, I'm also speaking under correction. SAPRA does not just issue a license when they regulate and registers a company. They don't just use documents from that company. They go through the documents. The company will tell them, firstly, where they manufacture that product, how they manufacture it, what can it do, what are the side effects, etc. SAPRA is required to visit that company, wherever the location is. So when they issue a certificate, they are not issuing it just in the air. They issue it for that manufacturer, for that particular factory, because it is the one that has satisfied them. So that when we know that this medicine has been has been regulated and registered by SAPRA. They've registered exactly where it's manufactured, how it's manufactured, that they are happy with the factory conditions. And that's why we rely mostly on what SAPRA has said. And I'm happy that Khadija actually explained the area which SAPRA has flagged, that it had nothing to do with ARVs, because it will be illegal for us and we can be sued to give or consider any product that SAPRA has not regulated or has not given a certificate for. Thank you very much.
Yes, I think we should finish by 10 past, but there's still more questions that members that asked that are not yet responded to. Who's taking the other ones? The remaining ones?
Chair, I think most of the questions were the ones we are not answered, are the ones answered as by you. And Khadija, please answer them. The chairperson asked many questions about MQR, about Innovata, about BAS. Please answer those questions to the best of your ability, because I also did not hear you answering them, unless you did not write them down.
Also,
but I wrote
the
them
question
down.
that Honorable Chirwa asked for the price difference between BAS and Innovat.
Yes, please. Can you answer all those?
And they
Between
answered.
between yourself and the CFO, please do.
Okay. No, thank you, Madam Chair and Minister. So I did put in the chat the difference in prices between Innovata and BAS. So there's a picture there, and it shows you for the TLD 28.
Where is the picture?
It's in
You
the
can't
chat,
see
Minister.
the picture. Just
It's
talk
in
to
the chat.
it.
Yes.
Just talk to it. Talk to it.
Okay, so BAS, so Innovata for the TLD 28, the price is 56 Rand 86. And for the same pack from BAS is 62 Rand 40. For the TLD 84s from BAS is 170.49. And the TLD 84s from Innovata is 168.99. All this information, Madam Chair, is available on the Department of Health website. So we have what's known as the Master Health Product List, where all our tender information regarding the contracts is summarized into a list. So that is updated on a monthly basis with the price updates, new manufacturers, new contracts, and that's available on our Department of Health website. So just going to the manufacturers, I did mention previously that all the manufacturers have 2 manufacturing sites on their medicine registration certificates. So for example, I'm going to take Pharmacare. Pharmacare has 2 manufacturing sites, one in South Africa, one in India. The one in South Africa is obviously the one we know. The one in India is Lupin, which is related to pharmacodynamics, right? So Aurobindo, their manufacturing site is one in South Africa, one in India. Their site is Rapsa. BAS is a local manufacturer. They don't have an Indian manufacturing site. So that, although there may have been understanding about BAS having Avocare as their holding company, but that is a local manufacturer. Innovata has a number of manufacturing sites, 1 in India and 2 in South Africa. And as I said, their channel is different to BAS because they don't actually manufacture, they do third-party manufacturing. Viatris, the same. They've got their own manufacturing site in South
What is
Africa.
third-party manufacturing? Please, sorry to you, Chair. What is third-party manufacturing? Please explain it.
Third-party manufacturing? Sorry? Okay, third-party manufacturing is where you have
When you do that also, I've asked a question on local manufacturing what is your understanding of local manufacturing? Can you deal with that as well?
Okay.
Because, yes, what is
Okay.
local manufacturing?
So let me start with local manufacturing. I think local manufacturing is confused with local ownership. So local manufacturing is about local content and production, is where the site where the product is actually made. That was what we consider local manufacturing, and that is an understanding that is held globally. So for example, I'm going to take Cipla as an example. So they are an Indian-owned company with a manufacturing site in South Africa where they actually make the medicines, and they employ about 500 people. So it's about local manufacturing is about local content and production. Local ownership is who owns the particular company. And even that, if it is a public listed company, for example, like Aspen, then it becomes difficult to say who is the ownership. Is it South African owned? So that I hope I'm clarifying that for you, Madam Chair. Local manufacturing is about local content and production and is unrelated to ownership. Madam Chair?
I'm listening, trying to
Okay.
I'm listening to you because the issue you are doing that in terms of the specs, what do you want out of that? When you say it's local, because
we want local content and production. And
that's
that's
what you are
aligned to what
saying.
is in the Public Procurement Act as well. The new
Proceed.
Public Procurement Act talks about local content and production. So for example, MCure, they are manufacturing at bars. McLeod is an importer. Viatris have their own local manufacturing site here in South Africa as well as in India. So they do have local content and production in India, despite the fact that they are also manufacturing in India. So what we will do is ask for those batch manufacturing documents. That we do apply preference for local manufacturers, and that the reason and the rules that we have, and it's also contained in our HDI, is that when we do price negotiations, we negotiate with all the local manufacturers so that their prices come within range of what is acceptable for us, affordable basically in terms of the budget that we have. And the reason why we do this risk mitigation strategy is to just make sure that we have a mix of local and importing manufacturers. Just to give you some insights about why we do this is if you look at what happened during COVID-19, our local manufacturers were at a disadvantage because they couldn't source API. So if we had relied solely on local manufacturers during COVID-19, we would have been in very deep waters because they were not able to supply for a long period of time. And it was the Indian manufacturers who were able to supply us because they could then manufacture in India. So in that way, by making sure that we allocate some supplies to Indian manufacturers, we get the advantage of price. And if there's an issue as we had experienced during COVID-19, we then have an intervention there. So we don't look at shareholding per se, but we do look at directorship. And that's how we picked up the hetero issue. So the shareholding does become a bit more complicated. And Madam Chair, as I had said, we have a meeting with National Treasury scheduled so that we can see how do we look at looking at the financial status, looking at the shareholding and directorship, etc. And I just wanted to mention that both BARS and Innovata are both out of business rescue. So they are now, in the green, and we are working with them to make sure that we get supplies from them. And hence, at this point in time, obviously we will be keeping an eye on them. We will not be in a position to cancel contracts with BARS and Innovata at this point in time. But should their supply performance deteriorate, which would then justify a cancellation, we will certainly take the necessary steps. Madam Chair, the packaging and labeling. So for us, local manufacturing, in terms of our definition as contained in the special conditions, is that you have to bring the API in, make the medicine up, package and label it, and then sell it to the market. So it does not only include packaging and labeling. So you have to bring in the API, you have to manufacture, and you have to then sell the finished product to us.
The question was putting to you that it excludes the importation of premixed products.
Yes.
So
they don't-
local manufacturing, it starts with formulation, packaging, and labeling
Correct.
at a local manufacturing site.
Correct. So they
Yes.
can't make the tablets in India, bring it in bulk and put it here. They must make the tablets here.
Okay.
Chair, sorry, Chair. The dates. Khadija said she's going to look for the dates. There was a question here about changing companies just before the tender. It needs to be clarified. When did the company come in? At what stage was the tender passed? And they said you must give the dates, Khadija. I hope you found them.
Okay. So just in terms of the contract award, the new contract started on the 1st of December 2025. The contract letters went to suppliers in August of 2025. And that's part of our project plan so that we give suppliers enough time to be ready to supply on the start date of the contract. As I had indicated, we learned of the business rescue of Avocare on the 9th of December. So that was way after the contract or the contract letters went out. And that we picked up from the CIPC website as well. Minister, I think that was the question.
The question was about when did the new committee come in and when did the old one go out?
Okay. So the new committee came in on the 1st of April 2025, but the old committee completed their work. And so the new committee didn't take over the work of the old committee. So the old committee did their work, made their recommendation to DBAC, and then disbanded. So it wasn't like the new committee had to take over the work of the old committee. So the new committee was appointed on the 1st of April, but the old committee did finish their work before and made their recommendations to DBAC.
It's 15:15 and there are still questions that have not yet been responded to that I have on the list of members.
Yeah, Chair.
Yes, who's calling the chair? Mutubadze and Chirwa, their hands are up.
Yeah,
Yes.
Chair.
Yeah.
You know, as this thing is explained, I think we understand what we're talking about when we're talking about the ownership and the local production. And I think the minister, I just left it deliberately, but I feel that I must come back. You know, I did mention that, and I'm saying the minister of health has got a responsibility as a cabinet minister to interact with his colleagues within cabinet, because this is a resolution that was taken that we need to move towards the establishment of a pharmaceutical company. Now, state-owned company. Now, the question that I'm asking is that within that leadership, where are we? And he can't say, no, it's not our business. Because if he does that, the impression that is creating is that he enjoys the current situation because it's beneficial to see us not establishing this pharmaceutical company. And that's the point that I'm raising, is that is there any plan to cajole the colleagues within cabinet and come back to the nation and say, this is where we are moving in this particular area? That's all that we are asking. And I'm get worried if the minister is becoming dismissive around this particular matter and say, no, that is not our business. I'm asking the minister, can you help us in this regard? Please. And secondly, it has been confirmed that there was no due diligence that was done as it was expected. Now, I've asked, before we go to the SIUs and the like, is there any appetite to take corrective measures by the minister within the department as a person who's responsible? Thanks.
Chirwa, Bongoze, over to you.
Ngiyabonga Sihlalo. I think my concern is that in their responses, the department is raising more questions than answers, particularly on the issue of collusion, right? Because when we look at the the articles that are speaking on hetero, for example, and what the department was accusing of in regards to QSOL and PharmaQ, the gap is much bigger than what we are seeing now between Buzz and Innovata. Buzz and Innovata on the one product, gap yabo is R1. And if they were able to bring in the Competition Commission to investigate, the investigation isn't even concluded, by the way. So they dismissed the previous tenders purely based on allegation, nothing proven in court. In fact, they're still going through court processes. But they are not subjecting Innovata and BUS to the same process, despite them being owned literally by the same person. Because it's a private group, we can say it's owned by Dr. Naik, both these companies. And because they've set this as the principle, why are they not applying it to this side as well? And secondly, I just want to agree with the previous speaker, because in the Nayola is that due diligence was not done, and we've said this even before. What happens now? Like, is this the modus operandi that when the ball gets dropped, nothing happens, there's no repercussions? The DG is not answering to the fact that why did he sign off papers when he saw that there's a big gap of financial capacity not being proven on this particular tender? It really leaves less to be desired on how these things are operating right under people who are given so much responsibility. And I still allege corruption, Slalo. I really hope that the committee will make a resounding resolution to bring the SIU on board, to bring in the Competitions Commission on board in regards to Buzz and Innovata, because they've criminalized the previous tenders on the same basis. In fact, the Buzz and Innovata on that one product, the R1 difference, really leaves less to be desired, because and that needs to be addressed, Minister. And I really hope you share the sentiments. If you're going to set a principle on this level, then it must be adhered to throughout. And that we don't see these things repeating themselves, because then how then are we sure that this is not done in all other projects? How are we not sure if there's no set principle that the department occurs or operates in? Like you're explaining, it's well enough to say if there's only one manufacturer on one particular product, then it's explainable. It's something that you can hear. There's only one manufacturer, there's only one supplier, and we have to provide these medicines. That's absolutely understandable. But in this particular instance, there has to be much more that the department is answering to the committee in relation to how this process unfolded. It can't just be that this is it. When you have done so many, you've taken so many steps to address the previous tenderers on a much larger gap that they presented than the one that we have right now, that went under business rescue and that miraculously got saved by the very same hetero that you took out. But honestly, this can't be it. The department must really come back and give us tangible answers on what will happen. Consequence management must take place. It can't be left at this.
It's just the time factor. I would have loved us to proceed. Can you, all these issues, before Minister, I allow you to summarize. There still have questions that have not been answered on my side too. Maybe I can send them through to the DG on the issues around due diligence. I've asked several questions, they would remain unanswered. Also on the issue around, there's an issue that I raised around the Avake shareholding. I didn't get a answer. The issue on Innovata, they were previously removed halfway in the previous contract, through the contract. And then I asked, why would it make sense for now to it be contract? So there's a lot of things that we can then, for the sake of time, but I'll allow the minister to have a final parting shot with the view that all unanswered questions will be submitted to the DG in writing so that the DG can respond to that. That will also help us to determine a way forward on the matter. Minister, your parting shot?
Yes, thank you very much, Honorable Chair. Yes, I think the remaining questions, especially from you, must be put in writing. The two other issues I want to mention, Chair, because I thought I've explained this many times. I never thought we are not working together in local manufacturing. I simply said in this chain, it is not the responsibility of health to establish companies or manufacturing or industry. I've already told you that the Auditor General has long ago banned us from doing that. The establishment of pharmaceutical companies lies in the Department of Science and Technology and Innovation. That is their job. So what I did, and I'll insist that I've done my job in this case, was to approach the president, because Treasury was saying all we have to do is to buy local. Because I was telling them, the Department of Science and Technology were complaining that some of the product they produce here were not buying them. And Treasury said, no, health must just buy locally. And we told them that it can't just be health, because you give us a specific budget, and we've got to see whether that budget can cover as many patients in our country as possible. So I'm the one who initiated that meeting. The president chaired it, and the Minister of Finance was there. I was there as the Minister of Health. The Minister of Science, Technology and Innovation was there, and the Minister of DTIC. And I said, each one of you, please play your role for local manufacturing and for supply of ARVs in such a way that South African patients don't get disadvantaged. In that meeting, we agreed that it will go on, and we said the DGs in those respective departments must form a technical committee which come to report to the political committee. So all I was saying is that the Department of Health cannot establish industry. It is not our primary role. We consume what industry produces, but we are working together because, yes, I agree. I'm a minister in cabinet. That's why I saw this problem and approached the president. And I've just told you, we're not the only country in the whole continent of Africa. That is a very difficult thing, which went beyond even the ministers of health or treasury, all that. It was taken by the heads of states in the continent. That's why they formed this Achieve. They launched this Achieve over the weekend, in which I represented the president because he was still in the chamber, where heads of states were saying, this is a big problem for Africa. We are the biggest consumers, but we are unable to produce anything on our continent. Let's work together to produce it. To produce locally. So it's as high as in the heads of states. On the issues, chairperson, of whether you bring SIU or all that, I will abide to any resolution that the committee agrees on. I suspect the committee is still going to sit. If you say bring SIU, I'll welcome it with my two hands, and I'll be the happiest person on earth at the present moment if that is done, because there is an insinuation that I might have anything to do with this. If, on the other hand, it's just that due diligence was not done, certain steps were skipped, then we'll have to call an independent auditor. It can't be me who investigate that, because I'll be using the same officials who were involved in this. In that case, if the committee rules about that, then we'll get an independent auditor from some of the auditing companies, and we'll go on with this work. So we depend on your resolution, chairperson. We'll accept whatever you resolve. Thank you very much.
I think that's fair enough, Minister, and I think you've also made the way forward, and we want to appreciate that leadership that you are providing on this matter. So we'll end it here with the view that all unanswered questions will be submitted to the DG through our secretariat for responses. Then that will assist us to conclude on this matter. Once more, let's thank all the colleagues, the officials that attended the meeting, and you in particular, Minister. Your issue that you've raised with regard to the cabinet, I think that's the matter. Then when we schedule our matters, we'll need to look that every second Wednesday, so we can deal with all those matters that doesn't need your attendance. Then the other people, like officials, can attend. But we'll consider that as long as you share with us the roster to say, now we know next Wednesday it's a full cabinet, then it means the other Wednesday, unless if you are traveling, you will be around, and that's where we can schedule matters that need your attention. And let's adjourn here, because members still need to travel to Parliament, and I know majority of you are still in your homes, and the bus is leaving now in a minute. I think majority of you, as we're talking to you, they might be getting into the buses now. So under the circumstances, we can adjourn. Thank you. Enjoy your day further. The DG, watch the space. The questions will be coming your way. Thank you so much. Enjoy your day further. Good day.
Thank you. Thank you very much.
Good
Thank
day.
you very much.
Thanks,
Thank you.
Ede.
Bye-bye. Bye.